everyone. It gives me immense pleasure to welcome you all to this very exciting competition, first time ever on a quiz on a fever. And this is being done on a platform of Fever Foundation. I'm Dr. Manjula from Fever Foundation. So before we start the program, I would like to share with you all the rules and regulations of this quiz before we start. The next slide, please. First rule is this quiz is for the postgraduate student only. The quiz consists of multiple choice question. There will be 20 questions in this quiz. The options to be selected by clicking on the button on the text panel. So in each text panel, though video will be displayed, but there it is just for representation purpose only. You cannot click on the video. You have to use the button next to you, text button. And all participants are advised not to leave the platform till the end of the program. And do not go to the YouTube because you cannot play the quiz on the YouTube. It is only just for viewing only. So therefore, as a participant, please stay on this platform to play your quiz game. Then once you submit your answers, it will not be possible to revert it. There is no negative marking in the quiz. The winner will be selected with the maximum fast right answer. Fastest finger right answer will be the winner. And if there is a tiebreaker round will be conducted with 3 questions will be done to decide by the winner. And it is advisable to use the laptop and desktop for the better experience and easy of playing this game. And next slide, please. Very few more to advise the participant to participate from a place with good internet connectivity. If found to be any type of foul play, it will be candidates will be automatically disqualified and should not use mobile phone getting their answers from any of the colleagues and sitting nearby. And Fever Foundation is not responsible for any form of technical errors such as poor internet connectivity, etc. And please note that participation in the quiz implies that participants accept the integrity of these rules. The participants who have given incomplete or inaccurate personal and contact details will also be disqualified. Non-compliance with the rules result in automatic cancellation of the participant in the quiz and of the candidate in the for the prize. And please note the first and second winner from this zone will play as a team. Now we are playing as an individual. After we get the first and second winner from each zone, you will be playing as the West Zone representative, and you will be called to Bangalore for the national level quiz competition, which is going to be held during FEFCON 2022, which will be in November 5th and 6th in Bangalore. And for all the rules and regulation, quiz masters and the judges' decision will be final. You need to abide by their decision. So I wish you all the very best and let's enjoy and play the game. So before we start, I would like to introduce our judges and the quiz master for today. First slide, please. Our judge for today is Dr. Jagdish Channappa sir. He is known to all of you. He is a consultant cluster head of pediatrics at Manipal Hospital Group, Bangalore. He's a past president and respiratory chapter of Indian Academy of Pediatrics. He's a CEO of Bangalore Metrain LLP, and he's a consultant Child Central Bangalore and involved in teaching undergraduate medical students, postgraduate students, and nurses. He's been the president of IAP BPS from 2007. He's been the examiner for MD Pediatrics from 2007 onwards. He is organizing chairperson for several conferences, to name a few, Respicon. Certified in pediatric bioethics from Mercy Children's Hospital, Kansas in 2015. Certified by the Karnataka Medical Council and the Mumbai Medical Council. He is in the Hospital Ethics Committee, Manipal Hospital from 2012, 13, 2019 onwards. He's also in the immunization subcommittee of IAP, and he has been the COVID-19 pediatric task force for the government of Karnataka. Sir, it's our pleasure and have to as your judges and welcome to the quiz, sir. So we have our 2 quiz masters, very eminent pediatricians with us as a quiz master, Dr. Chetan Trivedi, MD, DP from pediatrics from Ahmedabad. He's a practicing pediatrician and a very well-known neonatologist from Ahmedabad. He practices at Neha Children's Hospital, Ahmedabad, and ex-honorary assistant professor and infectious disease consultant, UN Mehta Institute of Cardiology and Research Center. He's been an organizing secretary of several conferences, and he's going to be IAP Pedicon organizing secretary for forthcoming Pedicon 2023. He's a president-elect of AOP Gujarat 2022, executive member of CIAP 2016 to 21. He's a scientific conveyor of Wednesday Wisdom. Most of you have seen her. So every Wednesday, he will have a scientific meet called Wednesday Wisdom, and which is very, very popular. And treasurer IAP ID chapter 20 to 23, joint secretary of IAP ID chapter 18 and 21. He's a member of Academic Council CIAP and past president AOP of Ahmedabad, and authored several chapters in many books, and national trainer. And he was training, part of the training of central IAP activities, SOS Hope, IAP WAC, IAP Arab, APT, RTA, ATM, NTEP, etc. under 5 visa module, several of them, 90.98.7 FM fever module also. He is on the advisory board member of Fever Foundation. So Dr. Chetan Trivedi, sir, welcome to you as a quiz master, sir. So we have another eminent quiz master with us today, who is Dr. Agnesh Popat, sir. He is also a very renowned pediatrician. He's a practicing pediatrician in Rajkot since more than 25 years. He is a fellow of IAP since 2014. He has several positions held in various organizations, professional organizations. He is chairperson of IAP ID chapter 2021, national vice president 2018 IAP ID chapter, national executive board member of 2009 and 2013, president of IAP Gujarat in 2016, president of IAP Rajkot 2004 and 5, he's the president of IMA Rajkot 2000, and he is editor of many books, to name a few: Coffee Table Book on Vaccine, Vaccinology, ID chapter publication of 2022. He's been the organizer, very well-known organizational man. He has conferences organized, some namely for very many national, state, and local conference. He has been editor-in-chief of organizing Rainbow, a President Action Plan for Gujarat, and he is faculty of IAP, IMA national, state, and local conferences across India. So Dr. Agnesh, sir, welcome to you, and I welcome you as the quiz master for today. So now with all this, may I now request our quiz master to take over and conduct the proceeding, conduct the phrase. So over to you, sir. Thank you.
Very good evening, all the friends. At the outset, on behalf of me and Dr. Yagnesh Bhai, I would like to thank the Fever Foundation for giving this wonderful opportunity as a quiz master to attend this quiz, because it is always better to become a quiz master rather than take a participation as a participants, because here we have only we have to look that what is the correct answer, and the computer will show us the correct answer. So we are not at a loss at all. But what exciting thing will be for the participants and those who are PGs, I am sure you are going to love this, because we are having this zonal quiz competitions. We yesterday finished the East zone, today it's a West zone, and then rest of the zones will be every day will be taking. And as Dr. Manjula said that you will get an opportunity to participate in the finals if you do best. And most importantly, this particular session is not about only knowing or your knowledge, but how swiftly you answer. And sometimes, you know, our gadgets should be working properly, because our fingers and all, I'm sure that you young people are having a faster fingers than us. So I'm sure it will be a tough competition amongst all of you. So I think first I would request Dr. Yagnesh Bhai to go for a trial run, and he will be having 3 questions where you just start rolling out and you just practice it once. So these 3 questions are not going to be counted in your answers or in your tally. But after that, we'll start the quiz. So Yagnesh Bhai, over to you, sir.
Yeah, good evening, one and all. As Dr. Chetan has already narrated, we will be playing a dummy quiz with 3 questions. So Computer Ji, let us start with the first question. So first question is on your screen right now. India celebrated the country's dash Independence Day in August 2022. Options are 74, 75, 76 or 77. Your time starts now. So I know everybody knows the answer. The computer ji, right answer is 76th Independence Day was celebrated in August 2022. So this is the how we will be playing. So you get acquainted with your mobile or the laptop, whichever you are using.
I think Yagnesh bhai, here the trick was 76th, right? Because we know that Azadi Ka Amrit Mahotsav
That was
Azadi Ka Amrit Mahotsav is completed. So we finished 75. So there is a click. So many of us might have missed
75,
that.
yeah.
Yes.
So this is the way the questions are formulated.
Let's see what's the proportion of the people.
Yeah. So 68% said it is 75.
75th, they said.
75, they say 68%. So in a way, they were thinking correctly, but they didn't understand the question properly. So what you have to do is not only read the question carefully and then find the answer. So even 20% said it 76. So congratulations to all 20% who said it correctly. Now, computer ji, we can have another question. India's PM reintroduces the extinct cheetahs on his birthday last week. The cheetahs were brought from which country? Nigeria, Namibia.
I think he lost the connection. So
yeah, you please go ahead.
Zambia or Angola. Your time. Computer ji, time starts now. So this is a very recent event which occurred, and almost it hit the headline of almost every newspapers across the country. So I know almost everybody will be having a correct answer. The correct answer is Namibia. And computer ji also show us the how many of the participants said it correctly.
So I think here everybody was knowing that cheetahs have been brought, but Namibia, Zambia and Nigeria, all three are confusing
names. Yeah.
Yes.
Sir, so my guess is 100% will get it. Oh.
85%, yes. So almost near to 100%, not 100, if not 100%. So this is how we go ahead with the scheme. Yes, computer ji. Now we go ahead with the third question. Who is considered the father of surgery? Yatindra Mohan Sengupta, Chanakya, Chittaranjan Das or Sushruta? Your time starts now. So from the recent events, we had now gone to the past. So computer ji, correct answer is Sushruta. How many of them said it correctly?
Is if the people are interested in mythological things, then they must be knowing the answer. Because Sushruta is considered to be a father of surgery, and So that's a mythological thing. So those who are interested in that, and they must be reading, then only they will be able to answer. So I am sure, but the most common name which has been heard is Sushruta. So I feel like majority will be going with this correct answer. Yes,
and you are very right. More than 92%. Said it correctly. So these were the three questions, dummy questions whose answer we had not considered as a part of a quiz, but this is to acquaint you with the rules of the quiz and the speed of the quiz. We have decided to run this dummy quiz. So now we go start the actual quiz, and I request my co-partner, Dr. Chetan Trivedi, to start the quiz. Dr. Chetan.
Thank you, Yagnesh Bhai. That was a brilliant exercise. I think everybody must have checked their fingers whether it is working or not, and whether they have given the correct answer that has been flashed into on the screen or not. So now we will be going for the real competition. So friends, be ready. Don't get distracted. Check your net connections, and here the fastest you answer correct answer, you will be getting the chances to move ahead in the competition. So now let us go to the quiz competition by Fever Foundation Fever Quiz 2022, and your first question will be there on the screen right now. So the question is, the following is responsible for elevating the thermoregulatory setup. Your options are cytokines, prostaglandins, prostanoids, or GABA. And your time starts now. And your time's over. Now, computer ji, let us know the correct answer. And this looks very simple question, but still, let me check the first correct answer is, what is the correct answer for this? Cytokines. Yagnesh Bhai, this looked a bit simple question. So what do you think how this particular thermoregulatory setup is working?
Yeah, definitely. This is a very simple question, but we should start with the simple question so that the warm-up, this is almost a warm-up round. So friends, the cytokines are the major regulatory system which is controlling the temperature of the body. So in case of infection, it increases an amount, and that is why our temperature rises. So, Computer Ji, yeah.
No, please. Sir, I would like to add one thing, because we know that there is a hypothalamus which is having a thermoregulatory center. And we know that fever is an immune-mediated response to fight against the offending agent. So when there are pyrogens, they are liberated, that will cause the thermoregulatory setup to go up. So there will be a specific point at which the thermoregulatory set point will be there. And that will cause a fever. So that is one of the mechanisms for fever. Rest can be either if there is a heat production which is exceeding heat loss, or if there is a defective heat loss. So these are the reasons for fever. But in this particular question, it is been specifically asked, which are the following? That means the cytokines, they are pyrogens, they are causing this. So can we have how many of them they have given the correct answer? So 62% gave that B answer, and 32% they got the correct answer in form of cytokines. Now let us see who is the person who has given the correct answer in the shortest time. Deepak Kumar Patel, he took 4 seconds. Fantastic, Dr. Deepak. Fantastic. You have been very quick. Very many congratulations. So, Computer Ji, this was the first question. Now let us go to the question number 2. Which statement is incorrect about the viral fevers? A, viral infections cause high-grade fever. B, abnormal interfebrile period. C, disseminated involvement. And D, family members may be affected. And your time starts now. time's up. Computer Ji, can we have the correct answer? It's abnormal interfebrile period. Now, this is very tricky. Here, the question was which statement is incorrect, right? It was not asked which was correct. And yes, because we know that in viral infections, the interfebrile period will be absolutely normal. Child will be playing. Yagnesh bhai, your thoughts on this?
Yeah, definitely. Viral infection causes very high grade fever. It has a disseminated multi-system involvement, or many system, including respiratory, GI tract, or even there was sometimes CNS also. And usually, of course, not always, but usually other family members are always affected. So multiple family members in the if they are affected with the same disease, usually goes in favor of the viral infection.
So rather,
only wrong thing was the interfebrile period here.
Correct. So rather, when we want to pick up the bacterial infection, we look at the child. If he looks sick only, even without peak of fever also, that will give us a clue that it can be a bacterial infection. And we know that viral infections, viral fevers are very high grade fever initially, then gradually they go down in 3-4 days. Well, bacterial infections, they go for gradually they'll come up and then will remain there even after 3-4-5 days. Then either the bacterial infection will localize or it can be in the blood. So this is the way viral bacterial they have been differentiated. So let's see how many of them given the correct answer. Computer Ji. Wow. 66% they have given the correct answer B. So majority of them have given the correct answer. Still 27% are confused with the disseminated involvement. So we should be knowing that viruses are the things that can affect any system anywhere. So when there is a diarrhea also, then there is a fever also, when there is a cough cold also, then it can be viral. Usually the bacterial infection will be localized. So let's get the person who has given the fastest correct answer. That's great. Dr. Parvati Balkrishna, she took 6 seconds. I think here you needed few seconds to read out the options and decide. Very well done, Dr. Parvati. Congratulations. Let's go to question number 3. And question number 3 is there on the screen right now. Erratic fever pattern is seen in which infections? A, viral fever, B, bacterial infection, C, malaria, or D, scrub typhus. And your time starts now. And your time's up. I think, Computer Ji, can I have the correct answer? And the correct answer is C, malaria. So I think half of the answer I gave it in a previous question with Yagnesh bhai.
Yeah, malaria was initially thought to be an alternate day fever, infection which causes a fever on every alternate day. But if there are group of parasites which are liberated every day, so that can be there will be episode of fever in between also. So erratic fever is very well known with malaria nowadays. Of course, the incidences of malaria are now decreasing, but still we should not forget we are in still an endemic area of malaria.
Correct. So we know that viral fever, there's a typical pattern of fever where initially it will be high, then gradually it will be getting down. Bacterial infections, they will be persisting fever, high grade in between the child is normal and not normal. Scrub typhus, we know that it's an acute febrile illness which has been caused by the bug called Orienta Shushugamashi. And here the fever, headache, and the rash, this is a triad for scrub typhus. And malaria, it is having an erratic fever pattern, and that's the correct answer. Let's see how many of them has picked up this malaria. Computer Ji. Oh, so majority of them, they thought the erratic patient pattern is because of the scrub typhus. So very few got that correct, at 22% to 1/5 of them, they got the correct answer. Let's see who has given the fastest correct answer. Dr. Sheetal Khade, she took 8 seconds. So now gradually we are going from 4 seconds, 6 seconds, and 8 seconds. Dr. Sheetal, many congratulations. I think this good that we are getting different winners for all the questions. Fantastic. Congratulations, Dr. Sheetal. Well played. Keep it up. So friends, now let us go to question number 4. And the question is there on the screen right now. Since it is impossible to measure the temperature of hypothalamus, the core temperature monitoring sites have been identified, and they are esophagus, urinary bladder, and choose one of them: small intestine, aorta, pulmonary artery, or ear canal. And your time starts now. Yeah, time is up. I think this is very, very tricky question. I really doubt, I rather presume that there will be less correct answer. Let me see the answers, Computer Ji. Correct answer is C, pulmonary artery. Now here, the catch is because what is core temperature? See, core temperature is the body's temperature of the organs, right? And we try to reach to hypothalamus because we know that thermoregulatory centers are in the hypothalamus. Now we cannot test that. So what we can do is either you have to go to the esophagus, bladder, or pulmonary artery. Through the pulmonary artery catheter, if you put, that will give you a correct answer, correct temperature, that is core temperature. People might be thinking ear canal, because what we think is because the eardrum has been also, given the blood supply from internal carotid artery. Similar thing is to the hypothalamus. So yes, it is a nearer to that, but it is not the best side to take the core temperature. Yagnesh bhai, your views?
Yeah, I definitely agree. Initially, I also thought it to be a ear canal because it is easier to take a temperature in the ear canal. There are many thermometers which are available to take the temperature. Of course, it is difficult to take a pulmonary artery temperature, but it is the best place from where you can decide the core temperature.
Because ear canal is usually, it is influenced by even lack of complete isolation from the outside atmosphere. Yes, as compared to skin, it is inside, but still you can have some contamination of auditory canal, or even a presence of wax can have some temperature differences here and there.
Can be there. Yeah.
So that's the correct answer. Let's see how many of them have given the correct answer C. Yes, yeah, my guess was right. My guess was right. And that's why I explained in detail that ear canal, yes, even me and Yagnesh bhai also were thinking the same thing. But we know that because if you want to go for gold standard, there is nothing like pulmonary artery temperature measurement. Anyways, now let us see who has given the correct answer. Dr. Deep Patel, very good, very good. Many congratulations. This was really a tough, tricky question. You took 5 seconds. That's again a very good thing. Many congratulations, Dr. Deep. Keep it up, keep it up. You can definitely win the race. So now let us go to the question number 5. Again, see, here questions are not going to be very simple. It will be maybe looking simple, but there are some trick into it. So just look at the question carefully, and then you answer. So Computer Ji, can we have the 5th question on the screen? The following is not a red flag sign in a child with fever. A, loss of appetite, B, organomegaly, C, weight gain, and D, rash. Your time starts now. Time's up. So Computer Ji, I think here also this is a tricky question. Let us see the answer. Loss of appetite is not a red flag sign. So here the question is not which is a red flag sign, which is not. So Yagnesh bhai, can you just dissect the things, or it looks a bit difficult?
In fact, loss of appetite may be considered to be a sign of not a good sign for the individual with a fever, not only with the child, even with the adults. But others, organomegaly, definitely yes. Rash, definitely yes, is a red flag sign. Weight gain may not be there as a red flag sign.
So here, like what is important is, see, usually with fever, any child will have lot of appetite. So if you have organomegaly, if you have weight gain, if you have rash, I think that is definitely not normal thing to happen in patient of fever. And that's what we want to highlight, that that is not the red flag sign in a child with fever. So here I think I must say there has to be some competition between A and C. Let us see what are the answers. So as I expected that majority they went with C, weight gain, but the correct answer is A, loss of appetite. And let us see who has given that correct answer in a short test time. Again, Dr. Parvati Balakrishnan, she took 7 seconds for the correct answer. Many congratulations, Dr. Parvati. So well done. And now I think, Computer Ji, can we have the next question on screen, question number 6. Look at and read it very carefully, friends, and then you answer. The next question on the screen, Computer Ji. Okay, the periodic fever associated with mevalonate kinase deficiency associated with cervical lymphadenopathy, abdominal pain, vomiting, diarrhea, arthralgia, and skin manifestation. Options are A, hyper IgD syndrome, hyper IgE syndrome, hyper IgG syndrome, or hyper IgA syndrome. Friends, please correct it. D is hyper IgA syndrome. Your time starts now. Time's up. So here I clarified the D is IgA syndrome, right? So friends, you have to answer accordingly. Computer Ji, can we have the correct answer, please? Hyper IgD syndrome is having this sort of presentation, because we know that IgE syndrome, again, you know that IgE, IgG, and IgA, all three are, defect of immune system. Well, IgE is usually, high IgE level, dermatitis, and recurrent skin and, lung infections are there. So we know hyper IgE syndrome. Now, IgG syndrome, we know that there is again autoimmunity, malignancy, chronic infections. These are there of IgG. And when we talk about IgA, we should be knowing it is either a chronic rheumatic disease or inflammatory gastrointestinal defect. So, Yagnesh bhai, your say on this question.
Yeah, definitely is not a common disease, but one should especially all PGs should be well versed with such conditions. So I'm very hopeful that majority of them will be having a correct answer. Let us see what.
That is also my gut feeling. Also the same thing. Computer, can we say how many of them they get the correct answer? Oh, again, hyper IgE syndrome people have given. But we should be knowing that is more of a dermatitis that was just seen there in the complaints. But if you see, there was not lung manifestation. We know that hyper IgE, usually lung manifestations are there. So here the A is correct answer, hyper IgD syndrome. 23% they gave the correct answer. Let us see who has given the correct answer in shortest time. Dr. Lakshmi, another champion we have got. Oh my goodness, this is a record. 3 seconds she took to answer. Fantastic, Dr. Lakshmi. You will be definitely given benefit because you have given a very correct answer in a shortest time. So I think you have a good chance to go ahead. Many congratulations, Dr. Lakshmi. Computer Ji, I think 6 questions are over. Now let's go to question number 7. And the question is right there on your screen. Friends, look at it. In children with Sjogren's syndrome, the most common clinical symptom is recurrent parotitis, recurrent otitis media, recurrent tonsillitis, or none of the above. And your time starts now. And let us have the correct answer. I think my gut feeling is that majority of them will have given the correct answer. Computer Ji, correct answer is recurrent parotitis. What do you think, Yagnesh bhai? You know that this is a disease of dry eyes and dry mouth because the tears and saliva, they will get dried away. And there will be a swollen salivary glands, particularly parotid glands. And this is particularly, also there will be some, stiffness, joint stiffness or swelling will be there as a part of it. And many of times, you have dry skin and even vaginal dryness is there. So your say on this, Yagnesh bhai?
Yeah, definitely. Sjogren syndrome is not a common disease, but as Dr. Chetan has already said, it is a condition which is associated with decreased secretions at different places. So one of the main manifestation is recurrent parotitis. Yeah.
Yeah. And see, just few days back, I had a mother who was to deliver, a pregnant lady was to deliver having a Sjogren syndrome. So there, the vaginal dryness was really a cause of concern for us. So that's important. Yeah, it is uncommon disease, but yeah, you can find in your practice also. So friends, Computer Ji, can we see how many of them gave the correct answer? My gut feeling is majority. Yes, and correct. Because this is, I think, common questions which have been asked in all the competitive exams. And 54% of people, they said it is a recurrent parotitis. And let us see who is that lucky fellow who could make it to the Dr. Radhika Kadam. Again, a different winner for us. Fantastic, Dr. Radhika. Congratulations. You took 6 seconds to answer. So yes, you are in the race. Now let us go to question number 8. Computer Ji, can we have the next question on screen? Okay, now look at this picture. Sunburn-like rashes. They are seen commonly in Stevens-Johnson syndrome, Toxic-Saw syndrome, Kawasaki disease, or impetigo. And your time starts now. So time's up. And Computer Ji, let's have the correct answer on screen. Toxic shock syndrome. Now here I think people might get confusion between, say, even Kawasaki, SJS and TSS, because even Kawasaki is having this sort of discrimination. SJ is also having, but I think we should be knowing that TSS, which has been caused by the toxins, exotoxin produced by specific strain of either staphylococci or a streptococci. While SJS, if you see, usually they'll be around, mouth and oral cavity around. So mucocutaneous junction, eyes and all that. So that is about SJ syndrome. And Kawasaki, we know that the periangual around the tips of the fingers, it will be there. And impetigo, definitely it is not, and there is no question that, but typical words, sunburn-like rashes are very important for the answer. Let's see. Yagnesh bhai, your thoughts?
Yeah, fine. It is same as that. Continue.
Okay. So what's the correct, how many people have given the correct answer? 36% thought it is Kawasaki. Yeah, you are right, friends, that it is a discriminatory disorder, and that has been very well discussed about Kawasaki there. But as I said, it will be a periangual discrimination. And here the correct answer is TSS. Still 30% they have given the correct answer. Let's see who is the lucky guy who got the correct answer. Vatsal Bhadesia. Very, very congratulations, Dr. Vatsal. You gave it in 3 seconds. Again, somebody has to break this record of 3 seconds. 2 people are there tied at that particular time. Yeah, definitely we are not considering this. But yes, 3 seconds are very swift. And many congratulations, Vatsal. You are one more winner out of these 8. So new winner is emerging. So all the very best for further your progress. So Computer Ji, next, let's go to the next question. Question number 9. Friends, it's on your screen. Dye which is used to stain parasitized RBC in QBC test for malaria. What is it? Toluidine blue, crystal violet, acridine orange, or right stain? And your time starts now. Time's up. Time's up. Computer Ji, I think this is also very, very tricky question. Let's see what's the correct answer. Acrid in orange. I think here people must be knowing what is crystal violet. I think that people should have, because we know that that is to stain the gram-positive bacteria. Because first you give the crystal violet, and those bacteria who preserve that particular violet color, they'll be crystal violet colored. So that is gram-positive. And those who take a different stain, that is pink, that will be gram-negative. So that is for, we know that it is for the gram-positive bacteria isolation. Toluene blue, it's more for oropharyngeal carcinoma. So it is more for mucosal lesions. Right strain, and this is we are using for differentiating the cell types. When particularly we are using in a peripheral smear, or we are using in a bone marrow aspirates, or sometimes we are using in a urine examination. While acrid in orange, this is the dye which has been used to see that whether the malarial parasite antigen they attaches to this particular dye, and then this gives the correct reading. So that is the correct answer, acrid in orange. So Yagnesh bhai, I think this is the explanation what I thought of, because this PGs must be knowing that different stains are used for different
apart from
tests.
the all varieties of the pathological conditions also. So this is one of the way of pathological procedure.
Correct. So, Computer Ji, can we have the number of people? 45.71%. So majority of them, they have given the correct answer. So good, very good. PGs, you have good knowledge of this particular segment. So I'm very happy for that. Can we have who is the lucky guy who got the correct answer fastest? Dr. Parvati again. I think she's coming for the third time. So she is definitely in the lead. I must say, she took 5 seconds to answer. Many congratulations, Dr. Parvati. You're going great guns. Congratulations and all the very best for rest 11 questions. I think you need to be again doing these things consistently to reach to your destination. So Computer Ji, can we have the 10th question? And friends, your 10th question is there on the screen. The following is not a manifestation of Mediterranean fever: recurrent short febrile illness, abdominal pain, erythema nodosum, or arthritis. And your time starts now. Time's up. And I think here I feel that you must be getting the correct answers. And Computer Ji, can we have the correct answer on screen? Erythema nodosum is not the manifestation of Mediterranean fever. Yagnesh bhai.
Yeah, here you should definitely concentrate on the word not. Because sometimes it is difficult whether abdominal pain is there, arthritis is there, recurrent short febrile illness is there. You must be wondering which of them is correct. But on the contrary, all of 3 are correct, and this is not the manifestations of Mediterranean fever. That is a tricky question.
So we know that this Mediterranean fever, which is a genetic auto-inflammatory disease. Now here typically is there is a it occurs in recurrence. So it's a bouts, we can say bouts called attacks for say. It lasts for 1 to 3 days. So particularly that bouts can be a fever, it can be abdominal system, it can be chest, or it can be joints. So these three things are part of Mediterranean fever, not the erythema nodosum, right? So I think you must be getting the correct answer. Let us see how many percentage of people have given the correct answer. Computer Ji. Computer Ji, can we have? Okay. Yes. So my guess was correct that people, because the erythema nodosum was not fitting into it. And we know that there are typical conditions where the erythema nodosum occurs. So I think it was easy pick. Now it was easy to be correct, but whether it is easy to be the fastest, let's know who is that person who has hit the buzzer fastest. Dr. Fenil Thakkar, again, new winner emerging. He took 3 seconds. Many congratulations, Dr. Fenil. Fantastic efforts. I think, yes, you can be there. You must have given a correct answer previously also. Let's see how the total goes. And so keep it up. So we have many good people, like many PGs are coming into the race of getting the highest number. And we have reached to the halfway of our quiz. So friends, those who have got the correct answer, but they have not made it in time, don't worry, because ultimately your correct answer or your name, if it has been flashed on the screen, is not important. If you have given more correct answers, even if you have taken few seconds here and there, but still you can be in the lead. So be there, keep trying. And now part 2, I will be handing over to Dr. Yagnesh Bhai. Please, Yagnesh Bhai.
Yeah, thank you, Dr. Chetan, for conducting the first 10 questions of the quiz excellently. Now, Computer Ji, we start with the 11th question. So the question is in your screen, D-test in MRSA. Sorry, Computer Ji.
Can we have the question on the screen, Computer Ji? Okay.
So the question is, D-test in MRSA is used for A, inducible clindamycin resistance, B, macrolide linsomat streptogramin resistance, or macrolide streptogramin resistance, or all of the above. Your time starts now. Now, these are the 3 different varieties of resistance which we have said as an option: clindamycin resistance, macrolide resistance, or macrolide streptogramin resistance. So, Chetan, you want to have your comments?
Computer, let's have the correct answer first.
Yeah, first let us go.
All of above. So
All 3.
See, this is a wonderful test. We should be knowing about it because this is a very important test because it's a simple disk diffusion test. So usually, I think my guess is people must have given A as a correct answer. This is what I got. Yes, because we know that the MRSA isolates, which are been with inducible clindamycin resistance, they will be having sensitivity to clindamycin but resistant to erythromycin. So macrolide group is erythromycin. Lincosamide, we have our lincomycin and clindamycin, and streptogramin, that is another group. There are 2 different groups, group A and group B. They are again used in a MRSA. But suppose you have the report showing that there is the erythromycin resistant, but clindamycin sensitive. If D-test is positive, that means you should not use clindamycin even if it is showing sensitivity. So what is D-test? We use the erythromycin, we use say clindamycin. You put it on agar and then inoculate it. Then if you see that erythromycin zone, it is extending and taking the clindamycin zone. So then what will happen? The clindamycin zone will be cut like a D. So that is called D-test. It is D-test positive. That means erythromycin, if it is resistance and it induces the resistance of clindamycin. So if you use the clindamycin in that condition, it will be not working. So here it is used for all these 3: macrolide, say erythromycin, lincosamide, and streptogramin. So streptogramin A and B group are there. If you use A group, then it is bacteriostatic, but if you use both group, it is bactericidal. So this is interesting thing about the D-test in MRSA, and this we must be knowing it. So this is what we can have the good knowledge by this particular quiz.
Yeah, definitely excellent explanation, Chetan. And let us see how many percentage of participants have given a correct answer. Computer Ji?
Oh,
86%. Excellent.
So
Excellent.
So I was wrong.
I
was wrong.
Yeah. So our participants are much cleverer than what
Absolutely.
You are thinking of.
Yeah.
Yeah, and the fastest one is Dr. Lakshmi once again with 4 seconds. Excellent. Congratulations, Dr. Lakshmi. Well done. And now, Computer Ji, we move ahead with the 12th question. Fever for more than 5 days with thrombocytosis, and your diagnosis is SLE, Kawasaki disease, ehrlichiosis, or malaria. Your time starts now. Up. And the correct answer is Kawasaki disease. The Kawasaki disease is the disease where initially you will not have all have a clinical clues only. You will not have a diagnostic clue, but thrombocytosis may give you a clue after 5 days of fever. Chetan, your comments.
Yeah, Yagnesh bhai, here I think nowadays the Kawasaki disease awareness has been so much. Then I'm sure the practicing pediatrician looking at the question only will give the correct answer Kawasaki. Because first and foremost thing is fever, which is going to be there, high grade fever more than 5 days, that is only Kawasaki. The first requirement is fulfilled. Yes, then other things we know that the Kawasaki features are maybe you have a conjunctival, bilateral conjunctival injection. So it is only redness, not a purulent conjunctivitis is not a part of Kawasaki disease. Second thing, you can have changes in lips and tongue. There may be a strawberry tongue or cracked lips. Second thing. Third thing, you have a lymphadenopathy, that is unilateral lymph node, that will be there. Then you can have the extremity changes, maybe edema over hands. And last thing is the polymorphic rash. So this is typical of Kawasaki. You should be knowing about it. Now, you may get confused because thrombocytosis is usually a rheumatological condition. But SLE is a condition where you get a thrombocytopenia. Ehrlichiosis is, I think, is a rickettsial disease which is caused by ticks, and it is a zoonotic disease. And we know that malaria, even SLE, so these all are causing thrombocytopenia rather than thrombocytosis. So thrombocytosis with fever more than 5 days, here the best answer, the correct answer is Kawasaki disease.
Yeah, and Computer Ji, let us have a look at the percentage of correct answer. 59%. Excellent, excellent. And who is the fastest one? Computer Ji? There must be a tie between the fastest finger. Dr. Sheetal once again is here with the 4 seconds. Excellent, Dr. Sheetal. Well done. You had once again proved your caliber. So, Computer Ji, now we go ahead with the 13th question. A Pontiac fever is caused by Legionella, Shigella, influenza, or S. pneumoniae. Your time starts now. And the correct answer is Legionella. Yeah, here it is reasonably easier question with trial and error, even if you do not know it. Because Shigella will cause Shigella dysentery, pneumonia, S. pneumoniae because pneumonia, influenza again will a respiratory disease. So one which is left is Legionella. So
diagnosis by exclusion, we can say.
Yeah, diagnosis of exclusion.
So, but that interesting fact about Pontiac fever is, it's a Legionella which is causing it. So people must be aware about Legionnaires diseases. But this particular Pontiac fever is a milder form of Legionnaire disease, where we have influenza-like things, fever, headache, muscle aches, and most importantly, in Pontiac fever, you will not have the pneumonia. And the history behind this Pontiac fever is that it is a place near Michigan, in the Michigan, where long back, maybe 1960 or 70, there were so many workers, they fell sick. And then they found that this is the Legionella which is causing this particular fever. And that's why that name Pontiac fever came. So this is an interesting history behind it. But Legionella is the organism which are causing it. I think it should be easy pick, as Dr. Ignesh Bhai said, it is by diagnosis by exclusion. Let's see.
And the percentage of correct answer is, Computer Ji?
Yes.
95% did it correctly. And the fastest finger is? Rakesh Verma, 2 seconds only. Yes,
Fantastic.
fastest, really fastest finger, 2 seconds only. Well
Great.
done, Dr. Rakesh.
He broke all the records.
Yeah.
This is the way we should play. When you know the answer, we are confident, go for fastest finger, because you will be getting an edge over others. Very good, Dr. Rakesh.
Yeah, next question, 14th question of the today's quiz. Computer Ji. Double coordinate fever is seen in inflammatory arthritis, rheumatoid arthritis, psoriatic arthritis, or all of the above. Your time starts now. Yeah. And the correct answer is inflammatory arthritis. Any explanation to this, Chetan?
This is interesting. You know, I've heard quotidian, tertian, quartan fever. This is double quotidian. So here double quotidian means there is a 2 fever spikes a day. That's double quotidian. We know that malaria, we have different patterns, you know, quotidian, tertian, quartan. So every second day, third day, fourth day, like that. And here this double quotidian fever is also seen in maybe infective endocarditis or, you know, visceral leishmaniasis and inflammatory arthritis. I think this is a tricky question. I'm not sure how many of those PGs have picked up right. Let's see. It will be interesting to know how many percentage we have got a correct answer. If they get majority, I think I must go to PG to do it again.
So the Computer Ji, what is the percentage of correct answer?
I'm correct. I'm correct. Because it is very tricky, because everybody knows that it is arthritis, right? So, but it is specifically inflammatory arthritis. So that's the catch.
So it was a difficult question.
Yes.
And the fastest one is Rushi Barot, 5 seconds. Excellent, Dr. Rushi. Well done. Congratulations.
New hero emerging. New hero emerging.
Yeah. Karamsad, the team from Karamsad. Good, Rushi. Well done. Go ahead with it. Now the 15th question. Gloves and socks syndrome is caused by which infectious agent? Parvovirus B19, measles, HHV6, or S. pyrogenes? Your time starts now. And the correct answer is parvovirus.
I think this should be easy pick, I must say, because we know that measles, of course, we have not heard it because it's a gloves and socks. Here, typically, it is on a gloves and socks region, you get this particular rashes. Yeah. And parvo, we know that it's the 5th disease. It is also called slapstick appearance. It is there. Usually, this parvovirus, you know, it is known for hemolytic anemias. So, aplastic crisis. And usually it is found in between 3 to 12 years. But this particular glove and sock syndrome, usually we get in a young adults. So, measles cannot be there. HHV6, again, it is a Roseola infantum, or it is called 6th disease, exanthum subitum. So, here, usually we get younger children, and we must have seen that HHV6 causing Roseola infantum, causing a fever, which is a surprise rash. fever comes, fever goes, and then next day there'll be a surprise rash. So patient will present with high-grade fever with convulsion only. So that is typical of HHV6. And Streptococcus pyogenes, we can know that it is the bugs which are causing particularly a Streptococcus sore throat and a scarlet. So here Parvo B19, it is the correct answer. And we must be aware of this particular infection in our practice, because you can be in a very difficult situation if the patient gets an infection and he's getting the aplastic crisis.
Yeah, the computer G, the percentage of correct, yes, 49%, excellent, well done. And the fastest finger is Rusi Barot again, 3 seconds, excellent Rusi, well
So
done.
I think he has just come and joined the quiz or what? So here it is.
Congratulations.
5th and 6th disease is confusing. So people have been, more or less good numbers getting both the answers. Good, Rishi.
Yeah, computer जी, 16वां क्वेश्चन आपके सामने पेश किया जाए. Treatment of choice for empyema thoracis, IV antibiotics, VETS, thoracotomy, or ICD insertion and fibrinolysis. Your time starts now. And the correct answer is VETS. In fact, Chetan, these are the 4 options which show 4 eras of treatment. Initially, we only had an IV antibiotic, was the treatment of ICD insertion and fibrinolysis, and now finally we are going ahead with the VETS. So VETS is the correct answer and treatment of choice. So let us see how many percent.
I am sure the people must have guessed it correctly, because now
so it should be 100% this time.
Yes, so video assisted thoracoscopy is the treatment of choice, because you have the pus and there may be many septies. So it is very difficult to get away with ICD insertion. You might be opening up one particular area and there may be other which has been left. Yes, it was as Dr. Yagneshbhai very nicely said, yeah, ICD insertion fibrinolysis was just before the VETS regularly came into existence, and now everybody's going for VETS only. It's a wonderful technology. You can see it, you can cut the these particular things and you can clean it. So let's see how many of them they've given.
What is the percentage of correct answer? 40%.
Still,
there is a divided audience.
Yes. So still people are thinking ICD and fibrinolysis is the treatment of choice. But now we are shifting. Oh, Rushi.
Fastest finger again, Rusi Barot. Congratulations, Rusi, for consecutive 3rd win. Fastest finger. Great. Congratulations. So अगला 17वां क्वेश्चन कंप्यूटर जी आप स्क्रीन पे पेश किया जाए. LPA for TB recognizes resistance to which ATT? Your options are rifampicin, INH, both A and B, that is rifampicin and INH, both, or D, none of the above. Your time starts now. Time up. And the correct answer is both.
Yes, sir, you can continue.
So at least Someone keep the video on so I can know that it's Yagnesh Bhai's signal is going down or mine is going down.
Yes.
Yeah, we are here, sir, watching.
Okay,
Yes.
fine. Yagnesh Bhai's connection is a bit unstable. Anyways, so this is question was very interesting. Line probe essay for Yagnesh Bhai. Okay. So let me go ahead with the discussion that line probe essay is a multiplex NAT, nucleic acid amplification test. And Yagnesh Bhai, your connection is not stable. Okay, he left, I think.
Yeah. Chetan,
Anyways,
yeah.
fine. So line probe assay is to recognize the resistance to which ATT, and we should be knowing that there are two types of assays available, LPA 1 and 2. So one will differentiate, like decide that whether it is a drug sensitivity testing or resistant to INH and rifampicin both. And if you go for second line LPA, then it is for other drugs like fluoroquinolones. And here, important thing is line probe assay is to be done only in smear positive cases. So if you have isolated the organism or isolates are positive, then only you have to go for LPA. Otherwise, you cannot go for randomly. And this is having a turnaround time of around say 48 hours or so. So this is a very good assay. Now it has been done under government machineries. So we have to use it very sensibly. When we get a correct answer or correct isolates or smear positive, then only you have to go for LPA. Let's see how many of them given the correct answer. Very good, very good, very good. 62%. Majority of them they given the correct answer. And let's see who is the lucky guy, not Rushi again. Vatsal Badesia. Well done, Vatsal. You did wonderful job. 3 seconds. Yeah, fantastic. So now I think gradually we are shifting towards the end of our competition. 3 questions left, friends. Be attentive, try your best. Don't be panic, don't rush to give the answer. But yes, you give the correct answer. That will help you to reach to the top. So Computer Ji, can we have the next question? Question number 18 on your screen. Mefenamic acid is not used as an antipyretic because it causes a frank colitis in asymptomatic women. Overdose causes generalized tonic-clonic seizure. Mucosal damage due to impaired local prostaglandin synthesis and imbalance in equilibrium between the cyclo and lipooxygenase pathways of arachidonic acid metabolism, or all of above. And your time starts now. Time's up. And this is very, very interesting question, Yagnesh Bhai. Because mefenamic's use is nowadays, been in rise. People are using left and right mefenamic acid. So this is very important. Let us get the answer first. All of above. That means mefenamic is not to be used because there are so many complications associated with it. And usually the dose of mefenamic acid is a problem for pediatric population. What we have seen is, because it's a dose, it is inflammatory, if at all you want to use it, it is 2.5 milligram per kilogram. But people are using half teaspoon, 1 spoonful. That's the reason there's a more complication. So I think this is a good question to make the people aware that mefenamic acid is not to be used. It's not the choice of antipyretic. Right, Yagnesh Bhai?
Paracetamol is the drug of choice for whenever we are using it as an antipyretic, and we should avoid. There are plenty of complications, including those 3 mentioned here. So we should avoid using mefenamic acid, especially for 3 years.
So the thing is, paracetamol is the safest option. And people are using other antipyretics because there is a constant complaint by the parents that child is not getting afebrile. So we should be knowing what is our target. We want to make the child comfortable by reducing the temperature a bit, not to make the temperature 98.4. So if you want a temperature, because we know that we learned in this whole session that thermoregulatory set point is set. Body has decided to take the body's temperature to 103. So if you give the antibiotic that will decrease that threshold, it will bring it to 101. Suppose then the body temperature will be 101, not 98. So if the child becomes comfortable, that's our endpoint, and that's the way we have to use it. So paracetamol is a safe drug which can be given frequently also. Only thing is you have to see for the upper highest dose, and that's the only thing. Otherwise, the safest drug, paracetamol. So let's see how many of them they got the correct answer. Okay, so
44%. Good.
33%, 53% they found that there is some specific thing. But mind well, friends, all of above are the side effects of mefenamic acid. Let's see who is the having a fastest buzzer. Deep Kumar again come bounce back after a gap of many questions. Many congratulations, Dr. Deep. Fantastic. And now I think we'll go for question number
question. 18.
19.
Sorry.
Yes, Yagnesh bhai.
Yeah, then next question, 19th question. Computer ji, पेश किया जाए. Fever, gingival swelling, blisters on the lip and gingiva, drooling, looks dehydrated. And the diagnosis is hypergenia, measles, herpes gingivostomatitis, or HFMD, hand, foot, mouth disease. Your time starts now. And the correct answer is herpes gingivostomatitis. Definitely yes. Fever, gingival swelling, and blisters. These blisters will be on the lips as well as in the gingiva. This will lead to a drooling of saliva from the mouth. And because of excessive loss of saliva, water through the salivation, the child may look dehydrated and sick. So the diagnosis is herpes gingival.
So, Yagnesh bhai, here, see here.
Your comment.
Yeah, here I think all four conditions can have something in the mouth. Correct. So herpangina, you will have on something on the throat. Measles, we know that will be a Koplik spots, right? Near the first molar. Hand, foot, mouth disease. This is again, there will be lesions in the soft palate or in the posterior part of the tongue. But here clearly it is been seen that it is gingivostomatitis. It is on the lips as well as on the tongue, it will be there. So this is, all four are viral infections. So mind well, even if you see ulcerative lesions in the throat, in the mouth, please don't think it is a bacterial infection and start antibiotics. Think about all these things. HFMD, you know, that is so many cases nowadays. So we have plenty. We will get the other things like the papillary lesions over the hands, foot, and even the buttocks. And typically the hand, foot, mouth disease patient also will be having first day only irritable child, younger child with the drooling only. Next day there will be some lesions will be found, and then you can diagnose it. So this, all four conditions are viral. Don't prescribe antibiotic. That's the bottom line. Yes, let us see how many of them have given the correct answer.
%. 48%. Good.
So one thing is sure that people, they know it is not measles.
One of them considered measles. Yeah.
Yes.
That is great.
And HFMD also they know very well.
Yeah. So there was confusion just between this herpangina and the stomatitis. Fastest finger is Rakesh Verma, once again with 4 seconds. Excellent. So we have a good race going on amongst the few of the contestants, at least visibly what we can see. We do not know the answers, other answers of the second and third number, but at least the first, fastest, there is definitely a race. So Computer ji, now we go ahead with the last question of today's quiz. May I have that question on the screen? Salt and pepper retinopathy is caused by rubella, cytomegalovirus, toxoplasmosis, or COVID-19? Your time starts now. And the correct answer is rubella. Yeah, comments.
Yeah, so this salt and pepper retinopathy is, I think there is two conditions. One more is, I think syphilis. Syphilis also having the same salt and pepper retinopathy, and rubella. Out of these options, rubella should be the first thing. We know that the different virus is causing different effect on the retina, and here why it is we are giving importance to rubella, because congenital rubella syndrome is very important complication in the pediatric population and the newly born babies. So if the mother is having rubella, then the child will have congenital rubella syndrome, and that's why we are now increasing. We had the campaign of MR vaccine, measles and rubella campaign, as well as the rubella vaccines in young girls, because when they become pregnant and they should not have the congenital rubella syndrome. And that's why this important disease to understand. And salt and pepper retinopathy is caused by the rubella out of these four options. And let's see how many of them they got it correct.
%55% plus. Very good. Excellent. None of them said COVID.
So they are all master of COVID.
And the fastest one is Abhishek Singh Rajput. Again, a new winner. 3 seconds. Excellent, Abhishek. So we are now through with the all 20 questions of the today's quiz. Our computer G is busy finalizing the summing up the various results, fastest one, the total corrected one, and taking into the consideration of both, not only the fastest and not only the maximum number of answers, but considering the both. The computer G will prepare the final result very shortly. But reassure friends, the person who gets the first number or second number, but I always believe the rest are also a winner because they participated in the event. Participation is must. To enjoy the quiz is must. And Chetan, your comments.
Yeah, see, I just now my mind is thinking that who will be the winner. If I get a winner whose name is not been flashed any time in the answers, then it will be very interesting to see who is a slow and steady wins the race.
Yeah, that is also possible. Definitely.
It is very much possible. So if the person has given all correct answer, taking his own time, I think he can get the good number, like the first number. Yes, Dr. Chinnappa sir.
I think I was really happy with the way both of you all conducted the quiz. It was really entertaining. So very nice of both of you. Now I want to ask both of you, how many? Yeah. Do you think there's going to be a tiebreaker or no tiebreaker?
It can be, because see, there were so many contenders for the race. So
there might be a chance of tiebreaker. There is.
No, I want you to place a bet.
My gut feeling is there will be a tie, but actually it will not be. That's what my answer.
Okay, fine. So this is like sitting on the fence, Chetan bhai.
Absolutely.
Acha, dusra, one small request to Mr. Jairaj and Manjula and Computer G. From tomorrow onwards, we'll reduce the time to 5 seconds, madam.
Average.
At least we can do it 10 seconds.
Sir, we should congratulate the teachers in the Western zone. And people are answering in 2-3 seconds. Wonderful teachers they have, like Dr. Chetan Trivedi sir and Yagnesh Papat and many teachers. So they have trained them so well that they're answering it so fast.
Hope teachers are not sitting with them.
No,
they must be sitting together. I think it is fun enjoying that.
All credits to the young generation, ma'am. This generation is really, really smart.
Yes. And most importantly, the good questions, the scientific questions, answers they were knowing. So that is a fantastic thing. That's what, see, our aim is not to make somebody win or lose. Ultimately,
yeah.
is a dissemination of knowledge. And that's there we are most successful, I must say.
Yes.
That with the permission of you all, can we just make one announcement before
Please.
the, yeah.
Yeah,
Abhira,
please,
can you
go
share
ahead.
the poster?
Yes, ma'am. I'm
Dear
sharing this
doctors,
now.
I would like to say Fever Foundation will be conducting case presentation competition like how we did last year. And we are opening it for you to upload your cases. It can be case-based or research-based, which you want to share. The only thing is that it has to be on fever related only. So it has to be, can you make it full? Yeah. So the poster, the rules of the posters are your poster, because it is showing unstable here. Your poster should be e-poster only. We are only accepting e-poster. We are not accepting anything, even if it is a hard copy and you have to take a picture and submit. No, it has to be submitted on the PPT, one single slide. The link which you will get it will have the template. So use the same template in of one single slide PPT for submit the posters. And the poster should be having a simple picture which is shown here, and it should be simple. But the guideline of this PPT, can you just go to the next ones? Yeah, just 2 minutes, I'll just finish. Can you go to the next slide, Abhira, the other guidelines quickly?
Yes, ma'am, it's open.
Yeah. See, the guideline for your virtual poster presentation topic should be related to fever only. It can be research based or it can be case based, and category of participation, case study or original paper. You can pick from the options which you will get in the Abhira is gone now. Yeah, right, it's come. And poster template to be used, and word should be limited for the title. For the title of your poster should be, the word should be less than 15. And along with the one single slide PPT, you need to attach an article in the Word format. It is something like a synopsis of your work. And then maximum number of words is 500. And the format which you need to submit, it will be as per in the Indian Pediatric, which is the official journal of IAP. So we have a scientific committee who will be going through all your posters, and they will be actually screening all the posters, and the top 10 people will be called to make the presentation. The first author will be asked to make the presentation, and then in that the first 2 winners will be announced, and all participants will be getting the participant certificate. So please upload your posters. We will be sending you your registered email ID we have. We'll be sending the link to you for uploading the posters. Okay. So over to our quiz master and the judges for announcing the winners. Please.
Let us keep fingers crossed.
Yeah.
At least there should not be tie.
As I see the result, there will be, sir. We have seen, because everyone answering was, so should be there.
Oh
the
my
way,
goodness.
because two people, I thought so. Let us see.
Okay. Computer Ji, can we have the results? Oh my goodness.
3 persons.
3 people. So, Dr. Manjula, we have to pick up 2.
No, sir. We have to play another round of 3 questions now. Tiebreaker, that's what we had announced. So let's see whoever fastest in that will get. Let us see whether we'll get first and 2
So
winners.
we'll be playing among these 3 only, or?
Yeah, these 3 only. First
Yeah.
and second will be chosen from these 3 only.
Sure.
Yeah. So can we please, yes, sir, can we, only these 3 people, can you put the name again? We will just repeat the name. Can you put that?
So if the somebody else is pressing, then it will not be seen, no? Correct? Okay,
They
fine.
should not be.
Not be
So I
counted.
presume, Dr. Manjula, that all 3 have scored equally.
Yes, sir. All 3 have scored equally. All 3 have scored
Okay,
equally.
Fine.
So can we get that, how many seconds it took that way?
No, sir. What we can do it in the next, if the tiebreaker round, first tiebreaker round, we will run the 3 questions, and then if continuously, then you will ask them one question. Whoever like that, single question, then the timing. So these are the three options. Kept it
Okay.
as we have.
So
Okay.
I think we have three people, friends,
Yeah,
and you have to pick up one from them.
Yeah,
right?
can you show that slide again?
Name, yeah.
Yeah, names.
You have to pick 2 out of 3, Chetan bhai.
Yes.
Achha, 2 out of 3. That's what I was asking.
Yes.
Yeah,
Sir.
okay. So we need to have 2 winners.
Yeah.
Fine.
Dr. Parvati Balakrishnan, Dr. Rushi Bharut, and Dr. Deep Kumar Patil. Only 3 of them will be playing. Others, please watch. Don't press any button. Only 3 of you will be playing this 3-question round, and whoever answers it, who let us get first and 2 from this. Right.
Achha, can we get something like this? Which are they are from which institute? Just to make it known to everyone. Do we have that?
We have that. I think usually they are giving at the end. Is it possible to give now itself? Who they're from which institution, or if you can put it, we can tell orally.
Yeah, Dr. Parvati is from which institute? If backend team can tell us.
Yeah.
The place and institute should also come on the screen.
Okay, fine.
Yeah.
No problem. They said they will need some time. Let us start that tiebreaker.
Yeah,
and then we'll announce.
tiebreaker finals
We'll
may
start,
we are going to put it. Yeah.
So Dr. Parvati, Rushi, and Deep, 3 are contesting, right? Rather fighting for the top 2 slots.
Yes.
Okay. So Computer Ji, are you ready to take the tiebreaker round?
Yeah.
So the first question for tiebreaker. The question is, 11th old male child presented with fevers for 7 days, swelling of knee joint, red lips, peeling of skin, cervical node enlargement. Investigation showed elevated ESR and thrombocytosis. What is your diagnosis? Your time starts now. Time's up. I purposefully didn't give the time for options, reading the options, because if I read the options by that time, because this case has already been discussed in previous case question. So they know the answer. So that's why I didn't give the options. Let's see what's the correct answer. Yes, this is what I described, rather, what is Kawasaki disease. I was not aware that this particular thing is going to go for tiebreaker, and this question will be there in the tiebreaker round. So anyways, I think Dr. Manjula will be having the number here.
Yes, sir. We will be again showing same bar.
So let us see how many of these 3 gave the correct answer. Okay.
Yes. Correct.
I hope all of 3 of them must have given A.
Sir, then your work will be even more difficult.
I know. But see, that is what they have reached to this thing. So they will be taking the correct answer. Please, Computer Ji, let's know.
Yeah. It's very exciting, sir. So people really,
yes.
that too, 2-3 seconds, all are taking 3, 4, less than 5. 8 was the longest. Longest is 8. Not something very,
right.
Oh God.
Even we are excited.
Still, they have come all well prepared. So can we have the...
So Computer Ji is taking more time than the participant.
Computer Ji is the old version, I think.
So the new generation is faster than computer.
Yeah.
Computer Ji, you want to take a help of our participants?
Computer Ji is our generation. No, I'm talking about our generation. Our marketing.
Oh, so you're getting the... Acha. So Dr. Deep Kumar got the correct answer, right?
Yeah, in 4 seconds.
The fastest 4 seconds.
So, Yagnesh bhai, your connection is not stable. Yagnesh bhai,
Sir, you
should
go
I
ahead,
take?
sir. Yeah,
Yeah,
please
should I
go ahead.
take all three, Yagnesh bhai? Because your connection is not stable.
Chetan bhai, go ahead, no problem.
Okay, fine. So now
Fine,
Dr.
no
Deep
issue.
got
If
the
I'm
correct.
missing something, you can continue. No.
Yeah.
Second question I will take. Yeah, right now.
Okay, I'm taking it. So question number 2, newborn baby presented with diffuse erythroderma, tachycardia, convulsion and encephalitis. Maculopapular rash and bullous rashes are common in. Options are in front of you and your time starts now. Time's up. I think for this question, I would invite Dr. Chinnappa to discuss. Because this is what he taught us how to diagnose this condition.
I think the important thing here is that
just a minute, sir. Can we have the correct answer?
Yeah, sure.
Computer ji?
There is no differential here at all, because if you have a small baby who comes to you with multi-system involvement, especially involving the skin, and subsequently lands up with hyperpigmentation in around the nasal passages, etc., the diagnosis is almost certain. Stevens-Johnson syndrome doesn't affect the brain. It doesn't cause any brain issue. Toxic shock will not produce erythroderma. It will produce more of a peeling kind of a rash all over. And hemorrhagic chickenpox will be very characteristic with the lesions. The lesions will be vesicobullous, and in newborn babies, it's basically a very serious disease and will have a fatal outcome. So if you have a child with multiple involvement, then with bullous lesions and maculopapular lesions, most likely the diagnosis is chikungunya.
So if I think Dr. Chinnappa shows his patient's photograph once, you will never forget in your lifetime to miss the diagnosis. It's fantastic photographs, what he has a collection of it. Bullous lesion, bullous rashes, typical in newborn. If you see it, I think it's chikungunya. It is a spot diagnosis. Thank you, sir, for the enlightening about this particular condition. Computer ji, are you ready with who has got the correct answer fastest? So here, house is divided amongst 3. 57% got toxic shock syndrome. Nobody has given the correct answer.
Yeah.
Is it that?
It appears like that.
Yeah, because nobody is given C. So I think next question should not be asked to computer G that who has given the correct answer.
Yeah. So let's move ahead.
Okay.
Only 1 minute. How did these percentages come?
That's what I'm thinking.
Only 3 of them should be there. So it can't be this kind of percentages. Can we see who amongst the 3 answered the question correctly or wrongly?
Looking at this,
none of the answers. No one has answered it.
But why then it should be
33%.
Others are also answering. I mean, we are just
we may not consider it.
Okay, fine. So you are just discounting them. Fine. So still out of those answered, nobody got the correct answer. Very interesting. Okay. I think next question. Yagnesh bhai, your connection is stable. You can go ahead.
Yeah, the next question is name of dengue vaccine which is in phase 3 clinical trial. Options are TDV, CYD TDV, that is tetravalent dengue vaccine, then ATE, or all.
Your time starts now.
Your time starts now. And the correct answer is tetravalent dengue vaccine. So these are the 3 different vaccines which are in different phases of trial, out of which the tetravalent dengue vaccine is in the phase 3 clinical trial. So any other comments from the?
Yeah, I think, yeah. Chinnappa sir, I think this is the vaccine which failed miserably because we needed, to have at least positive dengue titer to be, qualifying for this vaccine. If you give it in the children who have not rather naive of dengue, then it will be causing a complication. Am I right?
Absolutely. I think this vaccine was introduced in the Philippines and withdrawn subsequently because of the increased mortality seen in those who have been vaccinated.
So, you know that we have the 4 types of dengue virus, type 1, 2, 3, and 4. So that's why it is very tricky to make the vaccine, because all 4 to be in one vaccine. So even if this has been tried in certain African countries in patients who have already got dengue once, and it is having a good result. So now it has been approved for, say, clinical trials also, and for a certain population where the area epidemiologically where the dengue is very high, there it is being successfully been given. So now let us see who has given the correct answer, or how many persons. Computer ji. Rushi Barot. 10 seconds. 10 seconds. 10 seconds. I think we have winner.
Yes, yes. Sir.
But we have to take 2 of them, right?
Yeah, we have to take 2 first now as winners, because both of them will be a team anyway. They'll be team now. So both will go into the finals. Dr. Jagdish Chinnappa can take the final call, sir. Sir, there are 2 people who have answered correctly out of 3 questions. 1, nobody answered it right. So you have 2 people who have answered it correctly. So we can take as a joint winner, sir.
Correct. Absolutely.
Yeah.
Absolutely.
So who were those 2? Rushi Barot and
Deep.
Deep. Wow. Great.
So can we have, along with their institution, the final slide?
Yes.
They will be, please, I will tell you, Dr. Rishi and then Dr. Deep, you will be playing as a team. Now that you are playing as an individual, but for finals, you will be playing as a team. You will be representing Western Zone, and you will be competing in the national event as a Western Zone competition. We will be sharing each other your contact details. Our team will send so that you can get in touch with them, prepare well, and then win the final. Okay.
So now I think Anand and Suryanagar, both from Gujarat. So it's a team Gujarat who is now I think me and Yagnesh Bhai will be part of them.
Yeah, please train them.
Yes.
Train them well.
So we are from West Zone. So as a team, Dr. Deep, Rushi, me and Yagnesh Bhai. So we are winners. Anyways, people, the narrow margin, I think, Dr. Lakshmi, who missed out? Third one?
Parvati.
She's from which institute? Can we have that? Because she just narrowly lost. So she's equally winner, I must say. She's from backend team. Can we get the institute name?
Yeah, 1 second. So there is one more announcement from the backend team here. Dr. Rishi Banot and Dr. Parvati answered the answers right, but Dr. Rishi answered it in less than 10 seconds. Parvati took 16 seconds to answer.
Oh, that's really narrow miss.
Yeah, that's a
Dr. Parvati, like my heart goes for Dr. Parvati. I am telling you. So,
Dr. Parvati is from Karad, Maharashtra. Krishna Institute of Medical Sciences.
Dr. Parvati, you played fantastic, and we feel very sorry, but you don't feel sorry, because you are winner, because we are taking your name 3 times more than others. So many congratulations, both the winners. And back to Dr. Manjula or Dr. Chinnappa sir.
Dr. Jagdish Chinnappa sir.
So I think it was a very, very fabulous conduct of the West Zone quiz. And I think all of you all will agree that the margins were very narrow. and we had a very good session. So I think we have two wonderful winners from Gujarat, and I think they're going to represent the West Zone with their respective teachers giving them all the important tips. But I'm sure that the final will be tough, and well, let them train as difficult as much as possible. But I'm sure that we will give them a good challenging quiz for the finals. So I think it was exciting, and we are looking forward to the other 2 days now, where we still have the east zone, sorry, the south zone and north zone still awaited, and so we will see how it progresses and how our contestants take part. So thank you very much for this wonderful show, Dr. Chetan and Dr. Agnish, and I hand it back to Dr. Manjula.
Thank you very much, sir. It was wonderful. I thank Quizmaster and the judge for having beautifully conducted the event, and thanks and all the participants wonderfully playing, and then everyone had come so well prepared, and then it was a tough competition, I guess. So I think with the permission of the panel, judges and the Quizmaster, can we close the quiz? Yeah. Thank you very much.
Yeah. Thank you all. Thank you very much.
Yeah.
Thank you, sir. Thank you. Thank you very much.
Congratulations once again.
Thank you. Thank you.
Okay. Good night.
everyone.
Recording in progress.
Good. Yeah, good evening, everyone. And it gives me immense pleasure to welcome you all to this special edition of Fever Foundation, the first ever quiz on exclusively on fever. Thanks for joining in and participating. Before we start, I am going to tell you some of the rules of the quiz, how it is played. So can we have the rules of the game, please? So rules include this quiz is for the postgraduate students only. The quiz consists of multiple choice questions. The option to be selected by clicking the button on the text panel. So you have a text panel, you need to click on the text panel. The video that is displayed with the option is only for representation purpose only. You cannot click on the video. Use the text box to answer your question. All participants are advised not to leave this platform, and please do not enter the YouTube, because in the YouTube you cannot enter any option. It's only for view YouTube. You cannot play. So kindly stay on this platform and complete your quiz on this platform only. There'll be 20 questions in the quiz. So please complete all the 20 questions. Once you submit the right answer, it will not be possible to revert it. There is no negative marking in this quiz. The winner will be selected by maximum fast right answer. Fastest right answer will be selected as the, yeah. And if there is a tiebreaker round with 3 questions will be paid and the decide to winner. Even if it's tie, our judges and the quiz master will decide. So it is advisable to use the laptop or desktop for a better experience of this game. And it is advised to participate from a place where you have a good internet connectivity. If found to be any type of foul play, will be automatically disqualified. And you should not use mobile phone for getting answers from any of your colleagues sitting nearby. Fever Foundation is not responsible for any form of the technical error, such as poor internet connectivity, etc. The participation in the quiz implies that participants accept the integrity of these rules. The participants who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participation in the quiz and the candidacy for the prize. And I just want to inform you all, first and second winners, there will be 2 first and second winners will be selected, and they will play as a team representing the zone. Today you will be representing the Western zone, and will enter the national level quiz competition, which will be at FEVCON 2022, November 5th and 6th, 2022 in Bangalore. So you will be playing the national quiz representing your zone as a team. Today you will be playing individually, but in the finals you will be playing as a team. And above all, quiz master and the judges' decisions will be final. All of us will be abide by the decision of the quiz master and the judges. So now, with all this, I wish you all good luck and please enjoy as well as learn a lot of things. So I am handing over to our judges and the quiz master to conduct this. Over to you all, sir. Thank you very much. And before I say, I would like to introduce our quiz masters and the judges. So Dr. Chandrasekhara, sir is the very leading rheumatologist, medical director at Chandra Rheumatology and Immunology Center. He's a president of Indian Rheumatology Association. He's a president, General Secretary of Society of Inflammatory Research from 2016. And he is a managing trustee of the Immunology and Arthritic Research and Education Trust and executive editor of Chandra Journals. Sir has been the faculty and the program coordinator for MD Fellowship in Immunology and Rheumatology in CRICR. And he has several awards and accolades. To name a few, 2015 Sir C.V. Raman State Award for Young Scientist from the Government of Karnataka, State Council of Science and Technology. 2019 IMA Pune Annual Neo Oration Award. 2013, he was given the Oration Award from National Rheumatology Association. 2000, Dr. Malka Reddy Oration Award from the Association of Physicians of India. So he has got several publications, more than 100 publications in the peer-reviewed international and the national journals, and his special interests include autoimmune disease, recurrent pregnancy loss, and silicon modeling. So Dr. Chandrasekhar sir, it's our pleasure to have you as a judge in this program, sir.
Thank you.
So can I have the next? Dr. Anupam Prakash sir is another judge with us. He's MBBS, MD, and PGCC. In the hospital medicine, PDCDM, professor and head of Department of Accident and Emergency at Lady Hardinge Medical College and Association Hospital, New Delhi. He's editor-in-chief of Indian Journal of Medical Specialties. He's the associate editor, API Textbook of Medicine, 11th edition 2019. Member governing body API 2019 to 22. Currently is the president, Board of Management, Delhi Diabetic Forum from 2016 to 2019. He's the president of Indian Society for Atherosclerotic Research, vice chairman of API Delhi chapter, member of advisory board of JAPI, JACM, Journal of Case Reports, and he is also on the advisory board member of Fever Foundation. Dr. Anupam Prakash, it's a privilege to have you with us as a judge.
Thank you, Dr. Manjula. Welcome everybody, all participants and the co-judges.
Yeah. So we have two quiz masters today, Dr. Ghanshyam Pangte sir, Professor of Medicine at Lady Medical College, New Delhi, Rheumatology and Medicine ICU in charge at LMHC, New Delhi. He is a Joint Secretary for Indian College of Physicians, API Delhi chapter. He is Executive Member of Delhi Rheumatology Association, ISER. Is associate editor, API Textbook of Medicine, 9, 10, and 11th edition. Is published more than 100 index, non-index articles in reputed journals. Co-edited several books, some of them being Pearls of Scientific Paper Writing, Research Methodology, Ethics in Clinical Research, etc. And Medicine, MD, NBE, postgraduate teacher and examination LD, AIMS and Rajasthan. So Dr. Ghanshyam sir, it's a great pleasure and privilege to have you as a quiz master. Welcome to you, sir.
Excuse me, 7:30 and birthday is there.
The next quiz master is Dr. Ramesh Agarwal sir. He is MD, FRCP, UK and FICP, MNAMS. He is presently working as Professor of Medicine at Lady Hardinge Medical College and Associate Hospital, New Delhi. He is a recipient of Srimati Pawan Kumari Jain Oration Award for outstanding work in the field of internal medicine. He chaired session and delivered lecture in various national level conferences, namely Diabicon, API DSC, and Epicon annual conferences. Served on the board of management of Delhi Diabetic Forum. Has more than 70 publications in the national, international journal. So Dr. Ramesh Agarwal sir, it's again a privilege to have you. And welcome to the quiz program, sir. So may I now hand it over this session to our quiz master to conduct. Over to you, sir, Dr. Ghanshyam, sir. Sir, you are on mute, sir. Can you unmute you?
Thank you, Dr. Manjula and the Fever Foundation team. And I welcome all the delegates for today's quiz. This is a West Zone quiz. This is a zonal quiz, and 2 participants will be selected from this, first and second participant who wins this zonal round. And they will go to the final in November, which will be held in Bangalore. It's a I think 5th anniversary and 5th time this is being held all over India. And this time it will be in Bangalore. So I welcome all the delegates and students, especially postgraduate. And this is only for postgraduate students. So anyone who is a senior resident or who is not postgraduate, kindly quit the quiz or do not answer the quiz, because even if you win this quiz, you may not get the award and you may not go to the finals. So we will start with, we have 20 questions for this quiz, zonal quiz. And each one will have 4 choices. And one of them will be the most appropriate. The winner will be fastest finger first. So anyone who's clicked any of the 4 options A, B, C, D, he cannot change it. So once you have clicked one thing, it is remains there. You cannot change. So whenever you put the button fastest finger first, it should be correct one. So wait and listen to the question before listening. If you click it, there may be a problem. And before starting, we will show you 3 questions as a dummy question, and we will just read it, wait for 20 seconds, and then we will see what is the answer. And once you are versed with this projections, this dummy question, we will start with 20 questions. And all the questions will be put up from our Computer G, which is a software, Genius software. This software is good enough to give you who has clicked at maybe 1 second, 2 second fastest finger first. It will give you within 20 or maybe 40, 50 seconds. And within that time, and we will count how many of the person has given fastest finger first. And it can also detect if someone is Googling around that their laptop and all. It can detect it, and we can disbar that student if something misconduction is happened during the quiz. So we will ask Computer G to put up the first dummy question. We will start the quiz, and we have our judges as Dr. Chandrasekhar, Dr. Anupam, and Dr. Ramesh will be there to guide us during the process if there is a technical glitch. So we'll start the quiz. Question number 1, dummy question. Okay, so India celebrated the country's Independence Day in August 2022. It was 74th Independence Day, it was 75th Independence Day, or is it 76? C option and D 77. Your time starts now. Okay, so time is over, 20 seconds are over. So you have to, I think most of you have already clicked, and our Computer G will be giving the exact answer. And as this, I already told, we have a big question bank, and we also don't know which question is coming next and which will be the final 20 questions. So we all depends on Computer G that how difficult this quiz will be for this zone. So I will request Computer G to give the answer, because I also don't remember that it was 74th or 76th. So answer is C. So we have an answer that it's a 76th Independence Day, which is held this year, recently, last month only. So we will just see, Computer G, can we have the results? How many of students are given exact C answer? We can have a percentage distribution of these answer to first dummy question. This was a dummy question. You won't get any marks for this answer. So answer,
the trick was trick was 70 or 76.
Oh, Amrit Mahotsav was there. Okay,
but it is not years. It is 75th or 76th. So very trickily the question has been asked. So
okay, Dr. Manjula has already told you that it was Amrit Mahotsav is going on, 75th year is completed, and this was 76th Independence Day.
So let's see how they have got,
how it has gone. So B option, so 78% of the public has given as a B option, while the answer was C. So only 50% of the students have correctly found this. So we can go for a second question. It's again a dummy question. Computer G, can we start the second question? Okay, so India's Prime Minister reintroduces extinct cheetahs on his birthday last week. So it's come with cheetah again. So the cheetahs were brought from which country? Is it A, Nigeria? Is it Namibia? Is it C, Zambia? Or is it Angola? I think your time starts now. Computer G, time starts now. Thank you, Computer G. Very interesting question for a dummy question. I think whoever has read newspaper or even seen WhatsApp or Facebook, he must be knowing. Computer, give us the answer. Although most of them, I think 100% will be correct on this. The option which is correct according to Computer G is Namibia. Okay, so we all know it's Namibia only. So we have brought cheetahs and which are now placed in Madhya Pradesh, and our country is very proud. It's I think more than 70 years has passed since we have these cheetahs in our jungle in a natural environment. So we can
so what
have
is the guess, sir? 100% will answer right.
Yeah, chances are very 100%. Last option was difficult. I think this was easier.
Yeah.
Namibia. So answer is B, 60%. So still it's above the 50%. So I think our students are more inclined to the medicine teaching. They are less often involved in Facebook and social media and Twitter. So it's good. I think they will do better during the quiz or academic thing. So we can have a third dummy question, Computer G. Can we start the third question? I think you are now well versed how to put A, B, C, D, and please be on a laptop or a desktop. Who is considered the father of surgery? So this option is there. So there's a option, Yatinder Mohan Sengupta. Second is B is Chanakya. C is Chitta Ranjan Das, and D is Susrut. Computer G, time starts now. So I think it's a father of Indian surgery, not all over the world. And still seriously easier. Okay. Time is over. Thank you, Computer Ji. Very valid question. Although we are in a medicine field and still we should know some amount of surgery. So if you read all these, I feel here also a good number of people, I think maybe 100% will give a good answer. Computer Ji, can we have answer D for this or you want to change it? Okay, so Computer Ji also agrees it's D. And can we have the real picture? How many students are able to use their desktop or laptop to correctly the D? If they have any technical problem, they will know it immediately. So I think we are ready for master quiz of West Zone, and we can have the option how many have correctly answered. 90%, still 1% or some students are clicking left and right, and maybe. Okay, so we can start the quiz, main quiz, Computer Ji. Without wasting any time, we will start medicine zonal quiz, which is conducted by Fever Foundation, and it's a West Zone with 20 questions. And just to stress again, it's the fastest finger first. As soon as the computer starts 20 seconds, you have to answer the question. Computer Ji, can we have a first question? Computer Ji, pehla question. Everyone is ready. We should be, any technical problem is there, we are there to solve it. We can have the exact academic 20 question. Most of the question will be on fever and most likely infectious disease. Okay, so rectal temperature, first question we are starting. Rectal temperature are generally what Celsius higher than oral temperature? Is it 0.1 degree A option? B option is 0.2 degree centigrade. C option is 0.3 degree centigrade. And D is 0.4 degrees centigrade. Your time starts now. We are not able to hear music, but time has started. You all have to click A, B, or C, D. Okay, we are not able to hear the sound, but still 20 seconds are over. And here the question was rectal temperature is higher than oral temperature, and by how many degrees? Computer Ji, can we have the answer? 0.4 degrees centigrade. So highest one, the option, correct answer was D option. And there have been studies which suggest that rectal temperature, we usually take peripheral temperature in the axilla, or we can even have a, now scanners are there during the COVID where we can see the temperature on the forehead or hands, but reliability of skin or a superficial temperature is not very good. So usually we rely on oral temperature, and a lot of studies which suggest that real temperature of the body can be detected by rectal temperature, which has a slightly different thermometer, slightly smaller one. And this is the real core temperature we can detect. And studies have shown that temperature difference between oral and rectal is between the range of 0.4 to maybe 0.6. So higher the option, 0.4 is the correct answer. Computer G, can we have the distribution of the answers? How many people have correctly answered the question? Rectal temperature higher by 0.4 degrees centigrade. D option. Computer G, yes. So 38% of the students have correctly answered the rectal temperature. And here we can see that still we need to it's true that very few centers have rectal temperature. These thermometers are slightly expensive and only used in some big ICUs or during a research purpose when we have a study in which you really need to know the core temperature, or maybe patient who are being treated for hypothermia and where temperature regulation is very important, maybe a transplant surgeon's ICU. So Computer G, can we have the first questions winner? Fastest finger first, who won first question? So we have Dheeraj Kotwani, who has won first question, and he has answered within 2 seconds. It's great. I think 2 seconds just before, I think as soon as the timer has set up, he has clicked the answer. Congratulations, Dr. Dheeraj. Computer G, can we go to the second question? Okay, second question is body temperature is controlled by the hypothalamus. Oh, and damage to hypothalamus most commonly cause what kind of temperature discrepancy? Subnormal temperature, A option. B option is supranormal temperature. C is neutral temperature. And D is none of the above. Your time starts now. Thank you. Time is over. So we have a question where we have asked that what is the role of hypothalamus, and if it is if there is a dysfunction of hypothalamus, what will happen? So is it temperature will be reduced or temperature will be increased, or a supranormal temperature, hypothermia may occur, or there may be no change of this? So there has been studies which suggest that hypothalamus has a role in regulation of temperature, and whenever there's a reduction in temperature or patient's body become cold, it can sense from the peripheral skin, and it can raise the temperature by maybe a muscle contraction and all. So Computer G, can we have the answer? Okay, so subnormal temperature, A option was the correct option, because this suggests that if hypothalamus is dysfunction because of vascular cause, or there may be a traumatic cause, it will lead to that muscle contraction, which is controlled by hypothalamus, involuntary contraction, which will be absent there. And this may lead to a subnormal temperature, and patient may have a complication due to hypothermia. Computer G, can we have the distribution of how many students have really given the correct answer? So first option, 40%, good. So almost 50% of the students have correctly know that the hypothalamus has a role, and all of the D option was correctly guessed by the students. And Computer G, can we have the winner for question number 2? And it's Aman Pandey. Congratulations, Dr. Aman. And he has just answered within 5 seconds. So maybe we are giving 20 seconds. It's a longer term. Just to save time, maybe during finals, we can have a 10 seconds is good enough for answering this. Congratulations, Dr. Aman. Computer G, we will go to the third question. And if I am very fast, just let me know. Judges are there. If I am speaking very fast, we can slow down the quiz. Okay, so we'll start with third question. Pyrin protein encoding gene responsible for familial Mediterranean fever is located on chromosome. Chromosome number 12, A option. B option is chromosome number 16. C option is chromosome number 20. And D option is chromosome number 8. Your time starts now. Time is over. So I think most of you people have, it's a difficult question. It's a genetic question. And I know that clinical medicine, very few genetics testing is done. So it's not as such, and disease is also not very common in Indian setting, and very few cases has been reported. While this disease is more common in Mediterranean area and some European countries as well as Middle East, it's very common fever. And I personally feel next decade will be a genetic medicine. If we know that what chromosome is involved, we can have a specific curative therapy for that. So Computer G will tell us is option A is correct or not. Computer G, can we have the correct answer? Computer G. Okay, it's Computer G has given answer 16. So familial Mediterranean fever, I think Dr. Chandrasekhar is with us. He can add up with for something about familial Mediterranean fever. And there's a gene on chromosome 16, which is involved in familial Mediterranean fever. And it is an autoinflammatory syndrome in which, as such, there's no autoantibodies. We usually call it an autoimmune disease. But as such, there is no antibodies formation in this. We don't have any ANA ANCA positivity in this disease. And
it is
Dr. Chandrasekhar, can you add something?
Yeah. It is basically due to the instability in the inflammasome as a result of IL-1 and other secretion pathways. They secrete pyrogen in excess with unregulated inflammation, which is responsible for most of its clinical manifestations. So the mutation is at the chromosome 16.
Okay, so it's a chromosome 16, and this familial Mediterranean gene usually lead to formation of pyrin protein, which is involved in fever in this case. Computer G, can we have the distribution? How many correctly answered option? Okay, so 63% of the students have correctly answered. I'm really impressed. So 63% really know that there's a gene involved in chromosome 16. But the winner of this question will be fastest finger first. So within 3 seconds, Dr. Sai Prasad Janardhanan has the winner of third question. So now for first 3 questions, we have 3 winners. So I think it will be again a tiebreaker at the end of 20 questions. Congratulations, Dr. Sai Prasad. Difficult question, but correctly answered in time. We can have the 4th question, Computer G. Okay, so here we come the question on question number 4 on the motile zygote of Plasmodium is found in. Is it A, human liver? Is it B, human RBC or a red blood cells? Is it C, salivary glands of the female Anopheles? And is it D, the gut of female Anopheles? Your time starts now. A, B, C, D. Okay, so time is over. Computer G has closed the answering platform. And here 4 options are there. We have to remember the Plasmodium cycle, and in which male female Anopheles mosquito is the blood sucker, which is involved in this Plasmodium life cycle. And female Anopheles and these mosquitoes are the definitive host for this, because sexual cycles happen in these female Anopheles mosquito, and there only during sexual cycle some of the these zygotes and gametes, they transform and become ookinete, and they may become a motile. So Computer G, can we have the answer? Human is the okay. So answer option is D. So gut of the female Anopheles, where there's some motile zygotes are there. They move from the stomach of the malaria parasite, move from the stomach of the Anopheles mosquito and goes to the salivary glands. So option C is not correct, which is non-motile, and this is the motile one. So we can have the percentage distribution, Computer G. How many correctly answered option D? This was from infectious disease, and 60% of the students have correctly answered option D, which is female Anopheles mosquito. Computer G, can we have the Winner also for question number 4, Aman Pandey. Congratulations, Aman. So Aman has leading. I think he was the first answers winner also. So 2 wins for Aman. So he's leading quiz for West Zone. Congratulations, Aman. We'll go to question number 5. Computer ji, can we have the 5th question? Okay. So this is again on fever. There's a severe fever with thrombocytopenia syndrome, which is also called SFTS, is caused by, is it dengue virus, or is it Debbie Banda virus? Is it malaria parasite, or is it coronavirus? Your time starts now. Thank you. Slightly difficult questions. Severe fever with thrombocytopenia. I will also ask Computer ji to give the answer. Then we can discuss, is it dengue, malaria, Debbie Banda virus, or a coronavirus? Computer ji, can we have the correct answer? Okay, so answer is B, Debbie Banda virus. I think that it's a severe fever with thrombocytopenia, while dengue, if we recollect, dengue has most of the patients are asymptomatic and they don't even get tested for thrombocytopenia. They have fever for 2-3 days, and most of the time fever thrombocytopenia is not severe. Usually we take counts of platelets less than 50,000 as severe thrombocytopenia. So dengue option was out. Malaria, nowadays a good number of patients of complicated malaria is seen in India. Even Vivax malaria causes thrombocytopenia, but it is also not very common. So Debbie Banda virus has been associated with severe fever with thrombocytopenia, and there has been some cases in, I think, China where this virus is also called SFTS virus, and it has been associated with severe fever, thrombocytopenia, and good number of mortality. Luckily, it has not spread out of the China. Computer ji, can we have the distribution of marks? Okay, so option B was the correct answer, and dengue was not the answer. It was a dummy for thrombocytopenia, but not all patients have severe thrombocytopenia. So can we have the winner for this question number 5, Debbie Banda virus or a SFTS virus? Computer ji. Aman Pandey. Oh, congratulations, Aman. This is a 3rd win in 5 questions, and this time you have taken 7 seconds. Good. Congratulations, Dr. Aman. We will go to the 6th question. Computer ji, can we have the 6th question now? According to Yamaguchi criteria for adult onset still disease, all are major criteria except, you remember, except persistent fever, B is arthritis, C is sore throat, D is leukocyte. Your time starts now, and question is except. It's a tricky question. Thank you, Computer ji. So time is over. There are 4 options for Yamaguchi criteria. We have seen a good number of adult onset still disease. These patients are young patients which come with rash, and they may have a very high TLC count. They have a neutrophilic leukocytosis, and most of the time they have received multiple antibiotics, but they don't respond with antibiotics. So whenever there's a neutrophilic leukocytosis, evanescent rash which goes off after the fever, and patient doesn't look very sick, you should, and neutrophilia more than 10,000 TLC count, you should keep option of adult onset still disease. And out of 4 criteria, all are major except for 1. Computer ji will tell us which is the option which is except, not in the major criteria for Yamaguchi criteria. Computer ji, can we have the answer? Okay, so sore throat is not the criteria under the Yamaguchi. It's a minor criteria. Dr. Chansekar, if you want, you can add something or more about adult onset or more criteria like Fortnell criteria, if you want to tell something.
I think you have almost explained every bit of it. Any patient who presents with evanescent rash with a joint pain, with leukocytosis and fever, especially persisting fever or spikes of fever, with absent of ANA and rheumatoid factor, which also could be a requirement. In addition to that, a very high ferritin levels, etc., gives you a clue to a suspicion possibility of adult onset Still's disease.
Thank you, Dr. Chandrasekhar. We have some expert. Now we will take help of Dr. Anupam and other experts also. And Computer, can we have the percentage distribution? So question 6, option C was correct, 51%. Very good. I think they have read about Yamaguchi criteria. And can we have the winner for question number 6, Computer Ji? Okay, so we have a new winner for question number 6, Dr. Sonak Lohite. Congratulations, Dr. Sonak. And he has answered 4 seconds. So I think he is good in rheumatology. I think we will have few more questions on rheumatology because this quiz is for fever, unknown cause of fever and infectious disease. We can have a 7th question, Computer Ji. Congratulations, Dr. Sonak. So we have 20 questions. We'll start with 7th question. 7th question is, the following are indication for cardiac surgical treatment in patients with infective endocarditis where surgery to be strongly considered for improved outcome. So it's an absolute indication. Staph aureus infection with intracardiac complication of prosthetic wall is the A option. B is very large, more than 30 mm vegetation involving the native wall is D option. Is it persistent unexplained fever more than 10 days in blood culture, negative endocarditis involving native wall, and paravalvular extension of infection with abscess, fistula or heart block involving either native or a value of prosthetic wall. Your time starts now. Indication for surgery of wall. Thank you. His time is over. So Computer Ji has closed the answering option. So out of these, which is the absolute indication for surgery? Computer Ji, can we have the answer? It looks like D because it is the abscess is formed there. Okay, so answer D is correct. As per it is clearly written that it's a paravalvular extension of prosthetic or a native wall. So if there is an abscess formation, if there's a fistula and this wall is unstable, and sometimes this may lead to heart block also, should be a absolute indication for going for surgery, not waiting for any antibiotic to respond. We have more experts, Dr. Anupam sir or Dr. Ramesh sir. If you want to add something, you are always welcome, sir. Till that, Computer Ji, can we go ahead with the percentage distribution? How many correctly answered option D? Answer D is 48%. So correctly, out of 50% of the students are correctly answering most of the questions. So it's good. And it was a difficult surgical question. And we have a winner, Dr. Tejaswi Javare. And she is another new winner for question number 7. And we still have 13 more questions to go ahead. Computer Ji will go for the question number 8. These all questions are put by Computer Ji. We have a big question bank, and Computer Ji will go for the question number 8. And randomly, Computer Ji is selecting the question. And this quiz is for West Zone, and winner will go to the finals in Bengaluru, November 5th conference. Computer Ji, can we go ahead with question number 8? I think Computer is just thinking what question he should put. Okay, what is the incubation period for genital ulcers? Computer Ji, there's a problem. We can have a screen share from Computer Ji. Okay, so what is the incubation period for genital ulcers in synchroid? Is it 2 to 7 days? A option. B option is 1 to 14 days. C option is 9 to 90 days, and D option is 3 days to 6 weeks. Your time starts now. Thank you, Computer Ji. Your time is over. The question was, synchroid is the infection caused by lymphogranuloma varium. It's a large ulcers in the genital region, which are very painful, and usually it's come in STD. So more of a disease which is more commonly seen in dermatology practice, but still because it causes a lot of pain, and a lot of patient may be having a other STD or maybe a HIV positive also because of these have a exposure risk or multiple sexual partners. So which was the option, Computer Ji? Can we have the answer? A, B, C, D. Okay, so answer was 1 to 14 days. So any person who has got an infection within or a sexual contact within 1 to 14 days with a patient who is infected with synchroid or a lymphogranuloma varium can develop synchroid ulcer in his own genitals, and treatment is ceftriaxone is very effective drug, and beta-lactam can be used in this drug. Even single shot is good enough for treating these synchroid ulcers. So we have to diagnose these cases and take good sexual history also whenever we see these STDs before sending to maybe a dermatologist for further treatment, because syphilis and other diseases are also commonly seen in these patients. Computer Ji, can we have the percentage distribution? Okay, so good, 36%. Majority of the patient students have correctly answered. Answer was 1 to 14, option B. Computer Ji, can we have the winner for question number 8? Okay, so we have another new champion, question number 8, Dr. Asmeet Chawla. Congratulations, Dr. Asmeet. He has taken just 7 seconds to answer this question. Thank you, Computer Ji. We'll go to the question number 9. We still have 12 questions left to decide who's the winner of West Zone. Question number 9 on screen, Computer Ji. All are true for Kyasanur forest disease except, question has except Hartrix Haemophilus spinigera acts as a reservoir, A option. B is KFD or a Kyasanur forest disease virus is a member of virus family Flaviridae. C option, disease is endemic to South Asian countries. And D, person to person transmission is common. Your time starts now. And it's except question. All are correct except one. Time is over. So Computer Ji has given a question, Kyasanur forest disease. And in medical practice, MCQs, the standard teaching, what we teach in medical college, we usually say we should avoid question in which negative, stem of the question is negative, except and all. We should give a positive question whenever we are asking or assessing the students. So all of them are correct except for one, which appears to be, Computer Ji will tell us. Sir, Computer Ji, can we have the answer? Okay, so Computer Ji has suggested that D is the most appropriate answer. It's Kyasanur forest disease. Kyasanur forests are located in Karnataka. Few years back, or maybe a decade back, a good number of cases has been seen in Karnataka near Mysore. And heart ticks are one of the reservoir for this. Monkeys got infected with this, and KFD virus is part of the virus, which is correct. And only good thing was there was no person-to-person transmission, which is seen in COVID infection during this COVID. And we were all had to wear N95 mask, and we have to cover our face with mask. So good thing was no person-to-person transmission was there with KFD. and only person who got contact with forest animals or tick bite got this Casanova forest disease, which is fatal in good number of cases, 15 to 20 maybe percent. Computer G, can we have the screen for percentage of correct answer? Okay, so good. So answer was G, and good number of students, 82% has correctly answered. And can we have the winner for question number 9, Computer G? I will request Dr. Majula, she's from Karnataka, and our micro team is from Karnataka, Dr. Jairaj and all. If you have heard about KFD on recent surge, students will like to hear about this. It's a good, important for Indian students. KFD, Karnataka disease. Computer G, can we have the winner? Okay, we have another new winner, Dr. Shahana AL, who has won question number 9. We are, our Computer G is just assessing how many fastest finger first has been done by these students. I think Dr. Aman is still at the top with 3 answers. And Dr. Majula, Dr. Jairaj, will you like to add something on KFD as endemic disease to Karnataka? Or maybe Dr. Krishna?
Yes, sir. Sir, yes. Actually, this was the Casanova forest is one of the reserve areas in Karnataka, where it was identified in the year 1957 from the sick monkey in the Casanova forest in Karnataka, which was erstwhile Mysore state. And the reports also date back that almost around 400 to 500 cases were reported then. And also the heart ticks are basically the reservoir of KFD virus, as all of us we know and we study in the books. And these were the things, and I've also seen in rodents, shrews, and monkeys, which were the common host for the KFD virus. So this is the background. And of late, it was
no
reported.
Recent surge.
Yes, sir.
Okay.
Yes, sir.
No recent. Dr. Majula, want to add something? I think.
Is available, sir.
Okay, so there's some technical issues. Computer G, can we go to the another question? Continue with West Zone.
No, please. I just because my internet is very bad.
We are not able to hear clearly. I hope I am audible.
Yes, sir, you're audible, sir. Yes.
You're audible. Okay. Dr. Majula, want to add something? Maybe she can talk with the video off.
No, sir. I was talking that no, we have a vaccine which is usually used, if that vaccine is used in the endemic area, so it's a preventable with the vaccine availability here, especially in that particular area of Mysore, it's very common.
So good thing is there, we have already discovered the vaccine which is effective, and Dr. Majula has already now told that around that forest vaccination is going on, and maybe that is the reason we are not seeing more cases of KFD. Thank you, Dr. Majula. Thank you. We have good experts with local knowledge, and they are at the site of these diseases which has been discovered. We will go to next question, Computer G. We'll like to have the next question on screen. Dhanyawad, Computer G. A patient being treated for lymphoma with high-dose corticosteroids who presents with fever, cough, and shortness of breath, and time starts now. It's an easy question, I think. So time is over. There were 4 options. This patient is a immunocompromised patient, lymphoma patient, and he's on high dose steroid and most likely maybe on a chemotherapy also. And he has fever, cough, shortness of breath, X-ray, and bilateral interstitial infiltrate, which is classically seen in pneumocystis pneumonia. So most likely answer will be B. Computer G, can we have the correct answer? Okay, so it's a PCP pneumonia. Recently, pneumocystis carinii name has been changed. It has been now called pneumocystis jirovecii. So we are still using the old nomenclature, but doesn't matter. This infection is very common in these immunocompromised patients, and these patients may come with this bilateral infiltrate on a lung involvement, and treatment is with Septran and with involvement of this lung with bilateral alveolar infiltrate. We may also have to give a steroid for a month or so. So, Computer G, can we have distribution of correct answers? PCP pneumonia B is the correct answer. Lymphangitis is also commonly seen in cancer patient, but it may look like a bilateral infiltrate, but it's a non-infectious disease and doesn't come with this classical picture of fever and cough. Computer G, can we have the percentage distribution? Any of the expert want to add something? You are all welcome, sir. Till Computer G does the scoring and give us the percentage distribution. Nocardia is another atypical infection commonly seen in immunocompromised patients, and these are AFB positive patients, while PCP is PAS positive, and you can detect this PCP in sputum sample or a bronchial alveolar lavage to detect PCP pneumonia. And Legionella is the bacterial infection commonly seen in air conditioner, commonly seen in the good conference setting where these air get contaminated by wet air. Computer G is taking some time to check who is the winner and what is the percentage distribution. Can we have the answer, Computer G? Okay, so 43% of the students, majority have correctly answered PCP pneumonia. And as time has a good number of time is taken by our Computer G, maybe it's busy in detecting who all are Googling the answers. It is taking time. Maybe we will have to increase the memory of our Computer G. Computer G, can we have the winner for this question number 10? Good thing is, question number 10 winner is, I think Computer G is just given A. Okay, it's a Dheeraj Kotwani. Good. So we have a winner for question number 10, Dheeraj Kotwani, and he has answered correctly within 4 seconds. Congratulations, Dr. Dheeraj. We're still in the halfway stage only. We have completed 10 questions. You have a chance of winning this quiz, journal quiz of Fever Foundation. We'll go to the question number 11. It's a fever quiz. Questions are regarding fever and infectious disease and some autoimmune disease. We have expert panel here, Dr. Chandrasekhar, Dr. Anupam, Dr. Chandrasekhar, Dr. Majula, Dr. Karthik, and Computer G is the most senior most expert here. And he will give you the question number 11 from his big question bank. Computer G. Great. So question number 11, it's a 19-year-old female presented with a history of fever for 5 days, headache, retroorbital pain. This is the diagnostic thing for 3 days. Patient has vomiting and abdominal pain for 3 days. And investigation shows total TLC of 3,500, which is reduced. Hemoglobin of 15.5, which is slightly raised for a female, Indian female, and PCV of 45. Platelet has reduced. What is the most likely diagnosis? Hepatitis, scrub typhus B, C is enteric, and D is dengue. Your time starts now. So time is over. And here, this is another case of thrombocytopenia. You can see it's a female, and although we have not given the location where this patient belongs to, but likely we will take it as an Indian patient only. So classical finding is fever and a retroorbital pain, which is commonly seen in Indian setting in a dengue patient is common here. Thrombocytopenia also fits into dengue. PCV raise. If, I will like to advise our postgraduates that most important test for dengue is PCV or a hematocrit instead of platelet. We all because of media hype and because of so many misconceptions, we all run for platelets. We start treating platelets. We are start taking random donor platelets are infused without any indication. So most important thing is there's a capillary leak in dengue fever, and this capillary leak will cause hypotension and multi-organ failure, while platelet transfusion is rarely required and only to be given if platelets are less than 10,000 or person has thrombocytopenia with active bleeding. So you should all remember PCV is important. This is thing to be monitored in dengue patient instead of running for platelets count and treating according to platelet count. So I feel answer should be D in an Indian setting. Computer G, 88% of the students have correctly answered dengue. Very good percentage. I think this was the maximum correct answer we have seen. Question number 11. Computer G, can we have the winner also for question number 11? Winner for question Dheeraj Kotwani. Okay, congratulations, Dr. Dheeraj. Within 3 seconds, he is correctly answered, and he is again a winner for more than one time. So our computer and our Fever Foundation team is calculating who are the fastest finger first for this quiz, and whoever has the maximum will be the winner. We'll go to question number 11. Computer Ji, हम 12 number question पे चलेंगे अब next without wasting any time. Congratulations, Dr. Dheeraj. So question number starting of antifungal treatment not required in which of the following condition? Absolute neutrophil count is more than 1000 per cubic millimeter. B is persistent or non-resolving neutropenia on 7th day of antibiotic. C is fever persisting after 7 days of starting antibiotic. And D is high-risk febrile patient after broad-spectrum antibiotic. Your time starts now. Thank you, Computer Ji. Your time is over. And there are 4 options for starting of antifungal treatment. And you can see here that it's all empirical treatment. If you have a culture positive for any fungal infection, you will give antifungal even on the first day. But whenever you don't have a culture positivity and patient is running fever and he's immunocompromised, you do give antifungal treatment. But most important thing are in these patients are, one is absolute neutrophil count. Is it usually less than 1000 or maybe 500, or a patient who has ANC is on the reducing trend, maybe post chemotherapy or maybe organ transplantation. So I think A option is first. We should keep it. We should have kept it on the lower side. So I think answer should be A. Computer Ji, can we let us know what is the answer? While rest of the answers were persistent non-resolving neutropenia on 7th day of antibiotic. So whenever we have these immunocompromised patient, we start with anti-pseudomonal coverage antibiotic, and then when they doesn't respond, we add a MRSA cover with maybe vancomycin or any other MRSA antibiotic. And by 7th day, usually most of the ICU has a protocol to start antifungal treatment. So B is correct. And only thing is in this is not the indication. So answer A was correct, or incorrect. You can say should not be started only when antifungal should not be started when ANC is more than 1000. It should be less than 1000. So 38% majority of students correctly answered. And can we have the winner for question number 12? Okay, Dr. Sonak Lohite, I think he's also second time winner at least for this quiz. Within 4 seconds, he's correctly answered. So we are over out of 20, 12 questions are over. And we can go for the 13 number question for our West Zone zonal quiz or Fever Foundation. Computer G will go for question number 13. This is a question from the immunology or a rheumatology. P-ANCA positivity is specific for which disease? Is it SLE? Is it microscopic polyangiitis? Or is it granulomatous polyangiitis? Or is it IBD? Your time starts now. Time is over. Thank you, Computer G. So this question belongs to, it's a P-ANCA is a type of test, or we call it perinuclear ANCA. It can be done by ELISA method. It can be done by immunofluorescence method. And it is usually seen in a lot of, most commonly seen in vasculitis. So options were SLE, systemic lupus erythematosus, microscopic polyangiitis, or a MPA, or a granulomatous polyangiitis, also called vaginous granulomatosis, or IBD, inflammatory bowel disease. Computer G will give us the correct answer, and we can have Dr. Chandrasekhar on board for autoimmune disease expert. So it's a microscopic polyangiitis, or option B is the correct answer. Dr. Chandrasekhar, will you like to add something if you are there?
Yes.
Yeah.
Thank you, sir. Actually, we need to be clear that given the choice, the P-ANCA, when it is positive, you can best choose microscopic polyangiitis. But P-ANCA could be positive also with even sometime non-specific. So what we here, you have to be very choosy in your thought process. When you look into P-ANCA, what is the possibility of within the option? The best option would be is to go for microscopic polyangiitis. Unless like C-ANCA, where we can be very sure of vaginous or granulomatous polyangiitis, P-ANCA's specificity is little not so precise as much, but given the choice, among the choice, the best choice should be microscopic polyangiitis.
Thank you, sir. So, sir has correctly said it's a microscopic polyangiitis, and so patient, you should not do all patient who had fever go for a ANCA test. It should be done in appropriate clinical setting. So, patient who are having a who has infection has been ruled out, and you have a persistent fever, you have features of vasculitis in the systemic feature like weight loss, you may have a skin rash involvement, you have a renal involvement in the form of glomerulonephritis, or you have active sediments in the urine. There you should go for a P-ANCA test or an ANCA test. Not randomly, all fever should not go for a blanket testing. And correctly, 59% of the students have correctly answered P-ANCA as a microscopic pan. And we have the winner for this is a difficult question. I think it's a exit exam for MD. Exit exam. This can be an MCQ for them. So we have another new winner, Dr. Ajay Mohan, who has correctly answered in 4 seconds. Congratulations, Dr. Ajay. We'll go for the question number 14 for West Zone Fever Foundation quiz. Computer G, can you just show us the screen for question number 14? Congratulations, Dr. Ajay Mohan. So, question number 14. What is the antibiotic coverage of choice to be initiated in patient of high risk of febrile neutropenia? So again, another febrile neutropenia is there. Is this anti-pseudomonal beta-lactam? Is it B is IV fluoroquinolone? C is aminoglycoside, or a D is vancomycin? First antibiotic start. Okay, your time starts now. Time is over. So the question was, what is the antibiotic coverage of choice to be initiated in patient of high-risk febrile neutropenia? You all know that all of these antibiotics are used in febrile neutropenia patient, but it all depends which one to be started first. So, and we have to select the appropriate answer. As per this, I think first antibiotic is started is anti-subunal antibiotic beta-lactam. A should be the correct answer. And in some cases, according to situation, aminoglycoside, which are also good anti-subunal, are added. But the main drug which is effective in these patients are anti-subunal beta-lactam, which we should all remember. These are like ceftazidime, it may be a cefoperazone, and even we can use monobactam like meropenem, imipenem, or a piperacillin tazobactam. So these beta-lactam should be used initially, and if they doesn't respond, we can add a aminoglycoside, and later on maybe MRSA if someone has a catheter and other things. So computer G, can we have the answer, correct answer according to our computer and research data, which should be the most appropriate answer? Question number, I think it's the 13th question. So 48% of the students have correctly answered. It's a beta-lactam antibiotic. And computer G, can we have the winner for this question number 14?
I think, yeah, we have done.
Okay, we have Dr. Fanny Lewis. Congratulations, Dr. Fanny. It's a 14th question. You are still there. If you correctly answer next 6 questions, you will be the winner for this West Zone quiz. You still have a good chance. I request Computer G to also click the answer with the correct answer. I think we'll wait for Computer G to answer before speaking from the next question. Question number 15. Computer G. Okay, so question number 15. The following antibacterial agent cause QTc prolongation except macrolides, vinipristin, dalfopristin, fluoroquinolones, or a telavancin. Your time starts now. It's a except. Everyone causes QTc prolongation except one. Your time is over. So question was, the following antibacterial agent causes QTc prolongation except. So out of these 4, 3 antibiotics are causing QTc prolongation except for one. Computer G, can we have the correct answer? Okay, so answer was B, vinipristin and dalfopristin. These are the newer antibiotics, and we all should use antibiotic rationally. We should have an antibiotic stewardship program. Whenever antibiotics are required, then only we should use, because if you go to the studies and inventions in last 2 decades or 3 decades, I think less than 10 antibiotics has been discovered, newly antibiotics has been discovered. Out of them, this vinipristin and dalfopristin is also an antibiotic which has been recently used as a good MRSA cover or a methicillin resistant Staph aureus cover. And a good thing is that it doesn't cause QTc prolongation. We all know that macrolides, azithromycin and all, can cause QTc prolongation. Fluoroquinolone can also cause commonly QTc prolongation. And this is another new drug, telavancin, which is also a good MRSA cover. I don't think it's freely available in India. Very few centers may be having this. So these 2 drugs are the B and D were the MRSA coverage for especially febrile neutropenia and patient having indwelling catheters. There only this should be used. Computer G, can we have the percentage distribution? How this was a difficult question of vinipristin, and the answer was B, and only 9.38 students were able to correctly answer that this doesn't cause QTc prolongation. So I think whoever has answered, even if he has taken 15 or 20 seconds, he will be the winner for question number 15. And Sai Prasant Janardhan, and it's surprising he has answered within 4 seconds. Congratulations, Dr. Sai Prasant, and he's again the winner for more than one fastest finger first. Congratulations, Dr. Sai Prasant.
Maybe remember from his Harrison, sir.
The 20
Yeah.
seconds.
So I think we can have a tiebreaker because we have now only 5 questions, and 3-4 students are there who have correctly answered more than 2. And let's see. We have if we have a tiebreaker, we can have 3 more questions for them, and it will be a good learning exercise. Instead of 20, they will have 23 questions to remember and to practice medicine with these new things which are discovered. So Computer Ji will give us the question number 16, and it will be more difficult than the previous one, I think. Okay, so which immunomodulatory agent shows anti-inflammatory activities by inhibiting tubulin polymerization, plays an important role in mitigating the cytokine storm? Is it A, interferon? Is it B, colchicine? Is it C, statin? Or D, A and C? So A and C club together. So it may be answer. Your time starts now. One of these drugs causes tubulin inhibition. Time is over. So this was another difficult question. As we come to the end of the quiz, maybe Computer Ji will give you a more difficult question. So which immunomodulatory agent shows anti-inflammatory activity by inhibiting tubular polymerization and plays a cytokine storm? You can see it's again another autoimmune process in which we have seen in COVID. Good number of COVID patients has a severe cytokine storm, and we did use a lot of immunologic drugs, and we have expert with us, Dr. Chandrasekhar, also to go through it. But first, we'll ask the Computer Ji to lock the screen for answer, correct answer. Computer Ji, answer only. Okay, so answer was colchicine, and this drug is commonly used in autoimmune disease, especially gout. It's a very good anti-inflammatory drug, and it causes tubulin inhibition, and this may lead to improvement in fever and acute febrile response, as well as cytokine storm. As Dr. Chandrasekhar may have used hundreds of patients, maybe on colchicine under Dr. Chandrasekhar's treatment. Yeah. Sir, can you will you like to add something, sir?
Yeah, colchicine is one of the very good immunomodulator. Especially this is the same mechanism for which we use it in gout when there is an acute attack of gout. And it is for the same mechanism for which we use sometime in dermatitis, especially associated with the henoxalin purpura, non-specific neutrophilic dermatitis. In those conditions where especially the neutrophil high drive diseases are there, it is a preferred drug of choice. Rather than using steroids, sometimes you can just do away with using colchicine. It really helps in those set of areas. So it's one of the less explored drug, no doubt. I think there was an attempt, especially being repurposed in, as you said, in COVID pneumonitis, where it could really reduce the cytokine storm.
Thank you, sir. So gout, it is commonly used, and it is also called, gout is also now called, I think, sir, autoinflammatory disease, and cause one of the diseases, inflammasome-associated disease.
Disease, yes, that's right.
So we have correctly answered, majority of the students have correctly answered, 69%, very good and really impressive. And can we have the winner for question number 16? Is another new winner, Dr. Uday Patel. Congratulations, Dr. Uday. And he has taken just 4 seconds to answer this question. Congratulations, Dr. Uday. So we are coming to the end of the quiz. We have 4 more questions. Best of luck to all of the participants. I still feel if someone answers all 4 correctly, fastest finger first, he can still be a winner, because we still not have any person who has answered more than 3 correct answers. Computer Ji will go for question number 17. Ectodermatitis chronica atropicans is a late skin manifestations of Leptospira. A, B is Treponema pallidum, and C is Lyme borreliosis, and D is Rickettsia prowazekii. Your time starts now. Thank you, Computer Ji. Time is over. As I said, as we go to the end, questions will be difficult. And question was acrodermatitis chronica atropicans is a late skin manifestation of out of these 4 diseases. I think leptospira, you all know, common in India. I have not seen this term used in the leptospira, so this goes out. Treponema syphilis also is not a common manifestation. So out of C and D, one of this will be there. We don't have a 50-50 here. So we will ask the computer to just lock the screen, which is the correct answer. Okay, so it's a Lyme borreliosis, and correct answer is C. So Lyme disease is caused by borreliosis, and it's good thing that it is not very common in India. Very few cases has been reported. I also don't know why this is not very common in India because of temperature. We are a tropical country, more common in US, and this can cause a lot of problem in skin. And as per, if anybody of our expert has any experience with this skin manifestation, acrodermatitis chronica atropicans, if someone wants to add, you are welcome, sir. Lyme borreliosis and acrodermatitis chronica atropicans. So we have answer to this question was C, Lyme borreliosis, and good number, 70% of the students have correctly answered. And can we have the winner for question number 17, Computer Ji? Fanny Lewis, congratulations. So Fanny Lewis also has taken just 4.
Dr. Fanny has taken the lead from you, sir.
Again, a repeat winner for. Yeah, she is coming fast. I think best of luck to Dr. Fanny also. And now we have 3 more questions, and Computer Ji will slightly increase the difficulty level. Computer Ji will go for question number 18. This is hantavirus. Hantavirus as a zoonotic rodent-borne virus belong to which family? So it's just memorizing thing. It's a nidovirus family, it's a togaviridae family, it's a flaviviridae family, or a bunyaviridae family. A, B, C, D. Computer Ji, time starts now. Time is over. So this is hantavirus, is a zoonotic rodent disease, and this can cause pulmonary renal syndrome. This can cause viral hemorrhagic fever, and this can lead to death also, and good case fatality. Good thing is that it's not, it has not taken a pandemic proportion like our COVID, and although some cases of person-to-person transmission has been reported. So which family, Computer Ji will tell us out of these family, which family does hantavirus belong? Computer Ji, answer to question number 18. Okay, it's a bunyaviridae family, and if I remember, a few more viruses which are notorious in this family will be a Crimean Congo virus disease, which is again another viral hemorrhagic fever, which can get infection by aerosol, and cases has been seen in even Gujarat, and some cases has been seen in even Kerala. So Computer Ji, how many students have correctly answered? Correctly, 47. Again, majority of the students are correctly answering, and we can have a winner also for question number 18, Computer Ji. Majority of students are correctly answering, even if difficulty level rises with question number. So hantavirus disease causing bunyaviridae family. Dr. Dheeraj Kotwani, again, congratulations, Dr. Dheeraj. He has also good chances of coming as a winner or a first runner-up. Congratulations, Dr. Dheeraj, and he's answered within 4 seconds. So we have left with 2 questions only. We'll go to the penultimate question. Dr. Computer Ji will go for question number 19. Okay, so demonstration of halo sign or a crescent sign on CT thorax of a patient who is persistently neutropenic is indicative of what infection? Is it invasive aspergillosis? Is it histoplasmosis? Is it mucormycosis? Is it PCP? Your time starts now. We have a lot of questions on neutropenic patients who are immunocompromised. Thank you, Computer G. So time is over. This was the penultimate question before the ultimate 20th question. And this suggests that what do you mean by halo sign or a crescent sign on a CT thorax? I think most of the medicine students who are seeing critical patient in ICU and all, they all know the importance of CT thorax, especially when you have a fever of unknown origin or patient has a severe neutropenia. These are the patients who can develop a fungal pneumonia, who can develop a PCP pneumonia, or who can develop a very atypical nocardia infection also. So crescent sign is very typical of one of the fungal infection, which is just necrosis. There's a nodule there which get necrosed, and you have a crescent or a half moon-like feature is there. If that is there, radiologists give you a clear-cut diagnosis that it may be a fungal infection of specific origin. Computer G, can we have the answer? Computer G, answer to question number 19. Is it aspergillosis? So yes, it's an invasive aspergillosis, which is commonly present with nodules all over the lung field. And some of the nodules can cavitate by necrosis, and they give you a sign like crescent sign, which is common in aspergillosis. While similarly, inside that necrotic material, there may be a fungal ball also, which is also called aspergilloma. But this is invasive aspergillosis where you need a chemotherapy. So role of CT comes very important. Clinically, you by auscultation and blood tests, it's difficult to diagnose these cases. So CT has a severely sick patient and a neutropenic patient. We'll go to the last question. Or sorry, we'll have a
Yeah, we have got majority of them answering.
question 19. 71% of the students are correctly answered. It's very impressive. I think you people do know radiology and what is the role of these imaging. I'm really impressed. Congratulations. So we will have
We have the winner here, answer. Dr. Hemant Paikro.
I think Dr. Hemant.
Yeah.
Yeah. I think Dr. Ramesh Agarwal, if you are there.
Time fastest finger is missing here, but okay. So yes, 3 seconds. It's a very fast. I think one of the fastest finger by Dr. Hemant. And now we have a last question, and we have to give 2 trophies for zonal quiz, first and second. So best of luck to all the students who have answered correctly till 19th question, and best of luck to everyone. Computer G, we'll go for the 20th question. This is the final question. Femister triad, all are true except, just remember except, juxta-articular osteopenia, osteoporosis is present in Femister triad. Peripheral osseous erosion is part of it. Gradual narrowing of joint space is a part of it, or a seen in HIV-associated arthritis. Which of them is not correct? Your time starts now. This is the 20th question, last question. Best of luck to everyone. Okay, so time is over. So I think we have completed 20 questions, and this is the final. The Femister triad is a difficult triad. We all are very good at making triads and naming those signs. And this Femister triad is commonly seen in tubercular arthritis. So in this patient, you have juxta-articular osteopenia or osteoporosis. Peripheral osseous erosions are also there, and gradual narrowing of the joint space also there. So all tubercular is not HIV. So I feel answer will be D. Computer G, is it right? It is tubercular arthritis triad, trimester triad, and it is not seen in HIV associated arthritis. So answer D was the correct answer. You can say the wrong answer. All three are present in trimester triad. Computer G, can we have the distribution of percentage of correct answers for trimester triad? So 51%, majority of the students are again correctly answered. So I don't remember, I think maybe one question, the majority of students were not correct. All the questions were 95% students are correctly answered, most of the questions. So Computer G, we have a winner, Dr. Saraswati Rajput. Congratulations, Dr. Saraswati, for winning the final question, question number 20, and she has just taken 3 seconds. So we are over with 20 questions. We are closing this. Computer G's will do the calculation and will tell us who is the fastest finger first. Even if we have one winner, if second, there's a tie break for second position, we will have to run 3 questions MCQ for those tiebreaker. And I will hand over the stage to Fever Microcon team to continue with that till computer do some analysis and give us exactly who is the winner and who is the runner-up. Dr. Karthik and Krishna, Dr. Manjula can take over from here. Thank you, ma'am.
Thank you. Thank you so much, sir. It was wonderful. It was really great, and you did it single-handedly. It was wonderful. So, Dr. Chandrasekhar, sir, you would like to say anything, final words before we have
I think it was very wonderfully organized. I should congratulate and thank Dr. Ghanshyam. He has really taken it so smoothly and so nicely, explaining every aspect of the quiz. So, I mean, I could really see the answering profile of our postgraduates. I mean, it was really very good. I think I could see in majority of the questions, good proportion of the patients, good proportion of the students had answered it right. No, that's really good. So that puts us to say, I mean, into a very good scenario that yes, our students are really working hard and doing a real good job. I think I should also say that in one of the questions, which was news-based, the answers were where we were expecting 100% was lesser. So I think they are reading more books than the papers. I mean, that's good.
That's true. Thank you very much, sir. Dr. Anupam Prakash, sir, from Judges.
Well, a very good evening to everybody, and I congratulate every participant who has actually participated in it. I would say participation per se requires a lot of courage, and everybody who is participating deserves credit. You may or may not get the award, but participation in itself is very significant. And I think this is a very good event from Fever Foundation and FEFCON, that they are organizing an event because of the internet facility now available with everybody, and people are able to attend these quizzes and programs from home, which is a very big achievement, I must say, because it becomes very easy for students, and it is a launchpad for you to participate in future programs, even in live sessions. So that is one thing. So I congratulate FEFCON and all the participants. So everybody deserves credit. Then the next I would say is Dr. Ghanshyam did a wonderful job. And he has always been very, I would say, academic and entertaining. And he has that aura with him, and the way he presents. I don't think he is no less than AB doing this KBC type of thing. So that was wonderful, because he had all those things and art in him to conduct this quiz. So again, hats off to Dr. Ghanshyam. And again, I would say to the audience, the participants, that is a very important achievement, I would say. Many questions, as Dr. Chandrasekhar was also saying, that even a question which appears simple and in the news, at times we know the answer, but we have a doubt creeping in our minds and we make it wrong. This is natural for everybody. And I think those who know the answer or get confused at the last moment. So the STEM is derived, the choices are designed like this, that yes, at times they are very intricate and they do confuse you. So that is one thing which you should not get disheartened with that. So questions will come and MCQs are at times made like that you will get confused seeing them because you have read all the things and at times it becomes difficult to answer those things. So that is another thing which I think the participants should always remember and not get disheartened. And even when the results will be declared, I'm sure there will be some very near misses. And that again, I would say is very important because near misses are things which make you practical oriented. And in life also you have these near misses. So it is just like you say that the bullet passing through just near you, next to your pinna or ear. So those are the things which I would say these are very important things for all the participants. And we also learn and the variety in the MCQs answers that we have. So you have some A's, you have some B's, you have C's and D's. So you see, it just acts like a pyramid. In fact, the Dr. Chandrasekhar was talking about that question. You could see the answers were also in a hierarchical way. So A was less, B was more, C was more, and D was still more. So that is actually a representation of the population in general also. So you know that yes, there are people who will have majority may have a belief, so they may be majority may be wrong at times also. Majority may be right also, and at times there could be an equal amount of two answers which people think. So at times our teaching in our colleges or our orientation may not always be the correct perception. So MCQs actually gel you well. But yes, there are some people who master that art of answering. But yes, I would again give credit to Dr. Ghanshyam because there were some questions. There was one question which had choice of A, B, C. C was A and C, A, B, C, and D. D was choice A and C. And neither A nor C was correct. Usually it is A or C would be correct. So people actually fill up that MCQ that yes, A or C is correct or A and C is correct. But the choice was actually B. The correct answer was B. So these are interesting things and that tells you about what Dr. Ghanshyam's mind is and he reads the mind of the participants also. So credit to participants and to Dr. Ghanshyam also. Well, thank you so much. I think I have spoken a lot.
No, sir. Thank you so much. Dr. Ramesh, sir, you would like to say or before we make some poster announcement?
Yeah, I think, ma'am, Dr. Anupam has very rightly highlighted the importance of this quiz, that it makes the students more competitive and winning or losing is not the question here. The participation is more important. And many congratulations to quiz master, Dr. Ghanshyam, who single-handedly has taken both the computer G and the students along and conducted the quiz in a very nice way. Yes, ma'am. Over to you, ma'am.
Thank you very much, Anupam sir and Dr. Chandrasekhar sir as judge and Dr. Ramesh Agarwal and Dr. Ghanshyam sir. Sir, you rocked. It was wonderful and really it was a great. So now for all the participants, I would like to inform that we are going to be doing another scientific event from the Fever Foundation, which is case presentation competition. We did it last year. Same way this year also we are going to do that. So this will be in the electronic form only. We only accept electronic form of the posters. No physical copies or even the photograph of the physical posters are not allowed. So it has to be the e-poster and we will be sharing the format. It will be one PPT slide poster and the format will be available to you once you at the time of registration. You just download the format. In the same template you will be uploading the posters and then all this poster should be it can be a case based you can you can submit a case based poster or it can be an original research based poster and then our judges will when you are uploading your registration form you will see two download buttons where you can select whether it's a case based or it is a research where you will be competing. And then we have a scientific committee where they will be screening all your posters and they will call the top 10 posters for making the presentation and first author will be asked to make the presentation And your poster should have, the title of your poster should not be more than 15 words. And along with your one slide PPT, you will have to also submit an abstract or for an article, which is about 500 words. The format which you have to use is the JAPI format, the Official Journal of Association of Physicians of India. Also will be done, and the dates and other things you will see in the live link, which you are going to get it. So I request all of you to be ready with your cases for uploading, and then there'll be award for the winners as usual. So thank you very much. If everyone is ready, we are waiting for the winner. I would like to ask our IT team, is it ready that we can announce the analytics is over? Can we announce the winners?
No, I hope it's not a tie break. Okay, we have a clear winner. Great, great.
Yeah. Ghanshyam sir, you can announce.
Congratulations. We have two winners, first and second for West Zone. First place is for Dr. Dheeraj Kotwani. He's from College of Medicine, JNM Hospital. I'm not able to exactly make it out which exactly place is this, maybe Gujarat only or Ahmedabad. And Dr. Aman Pandey, he's from Gandhi Medical College. Both of you, congratulations and best wishes for winning the final also. And you will be invited by our Fever Foundation team to Bengaluru annually. I will love to meet you, Dr. Dheeraj and Dr. Aman, and we will give you best wishes to winning the final event also, not only journal. And I think Fever Foundation will meet you maybe tomorrow to just give you some bouquet and maybe some chocolate for winning the event. Congratulations again. Best wishes to you both.
Just one to add, sir, Dr. Dheeraj and Dr. Aman, first of all, congratulations. Secondly, both of you will be playing as a team. You will be representing the West Zone. You will not be playing individually in the finals. You will be playing as a team. So we will be sharing the contact details of each other. Please prepare as a Western Zone team, and you will be competing with other zones for the finals. So I wish you all, both of you, a very best wishes, and please come out winners once in the national competition. So anybody would like to
welcome to Bangalore.
Before welcome, you'll be coming to Bangalore on November 5th and 6th, where we are.
Yes, I just want to add one point,
ma'am.
The same participants, they can view the tomorrow's and day after tomorrow's quiz through YouTube. North Zone quiz and South Zone quiz, they can view in the YouTube. Another 40 questions and another good learning. So I would invite them, and they can contact our, we can send the link through the email itself.
Yeah.
Yeah, the YouTube link, which they can watch tomorrow and day after.
So what, sir, Mr. Jairaj was saying, you can view the other zonal wins. You cannot participate, but you can view them so that you will know other questions also. So it will be a learning process for you all. Right. The judges and the quiz masters, yes, sir, please go ahead, sir.
Your foundation team will meet you, and maybe also our computer team will like to see your iCards also. Okay, best of luck.
Right.
So if the judges and the quiz masters are allowing us that, sir, can we close this live session?
Yeah.
Yes, ma'am.
Yeah.
Yes, please.
Thank you very much. Congratulations. And also congratulations to all the participants. Okay, maybe one or two, all of your winners, because the way you were answering with a short period of time, and it was wonderful watching you all, and I hope you had some learning as well in this. So as everybody saying, participation is more important than winning. That itself is really a great achievement. And congratulations to each one of you. Thank you very much, and good night to all of you. Best wishes.
Good night.
Good night.
Good night, please.
Harshit, stop recording, please.